Good morning. Welcome to class 4. Today is the halfway point. You believe it's half over already? Goes fast. Really does. Okay. Over between last class and today, you guys had chapter 4 to read, and I know chapter 4 is a little bit overwhelming. Did the cheat sheet that I gave you help you at all? Was that helpful? Okay. You guys are the first ones to use it, so I'm trying to get feedback. All right. Is there anything that you would like me to change for future? Is it too overwhelming, too much information? Is it good? All right, good. Okay, so you took the test on page 184, and then you graded it using page 201 in your book. When I call your name, if you can tell me either how many you missed, or you can use that grading scale at the bottom of page 201, there in the corner, and tell me what your grade was. Either way is fine. Brianna? Okay. Natalie? 100? Thank you. Katie? Cody? Thank you. Thanya? Thank you. Thanya, do you have 2 and 3 for me? By any chance? I missed those.
Yeah, I missed 2, but I have 3. I have 19.
Okay. Thank you. Elena? Haley? August? Justin? Holly?
100.
Thank you. William? Thank you. Brandy? Thank you. Special? Harmony? Okay. Any questions on chapter 4? Anything you missed that you need me to explain to you? The biggest thing that I want you to understand is that our bodies change as we age. You're not going to be the same person at 80 that you are at 18. Everything changes. And one of the examples that I like to give regarding this is about the effects of changing on the brain, specifically memory. A lot of your patients, especially if they're older, may have some short-term memory deficits. And I want to explain to you why that happens, the kind of the mechanism of action there. So your brain is a memory-making factory. Yes, it has a ton of other jobs as well, but one of the big things that it does is it makes memories. And when you have a brand new factory, it's going to work very well, right? Brand new, state of the art, everything is good quality, it's consistent. If I were touring factories and I went and saw a brand new factory where everything is brand new, and then I went and saw an 80-year-old factory where the gears are rusty and half of the springs are missing, and it's just not going to produce good quality products, and it's definitely not going to be consistent, I would probably want to go with the brand new factory because everything is going to work properly. Well, your brain is a memory-making factory. So the memories that you make when you're young, when your brain is still relatively new, those memories are good quality memories. They're going to stick around for a very long time. But the memories that brain makes when it's 80 years old, those aren't going to be great quality memories. In fact, right now, that memory may not be made at all. Your factory might be offline. This is why a lot of times older people can't remember that they just had lunch, but they know the shoes that they wore to a piano recital when they were 12. And you're like, you just had lunch. I mean, we just walked back and you can't remember you had lunch? Well, remember that their brain right now, their memory factory is simply offline. Like any other old factory. It's going to have good days and it's going to have some not so good days. Don't get frustrated with your patient. That's normal. That is a normal aging process. So our job is to just say, yes, Henry, we just had lunch. We had grilled cheese and tomato soup, which is a great lunch on a, blustery day like today. Today is Wednesday. And just kind of work in that reality orientation into your answers. Does that make sense? Okay. But saying, we just had lunch, don't you remember? No. If they remembered, they would have told you they remembered. Trying to shame someone into making their factory work again is ineffective, and it's going to harm your relationship with them. Make sense? Okay. So understand that every body system is going to age like that. So today, the digestive system may not be working up to par, or the urinary system might be a little bit offline. Okay. And your patient has to go to the bathroom like every 20 minutes because the urinary system just isn't working quite right today. So as we age, we have to understand and we have to kind of help out where we need to help out for that day. Tomorrow will probably be a totally different day. Good. This took me a long time to realize. Nobody really explained it to me that way. It took me a long time to get enough life experience behind me to realize this, because in my 20s, I had no idea. I just thought old people were old. And I never really stopped to think that each part of their body ages. So that's why I like to point that out, because you may have intuitively known that, but I wish somebody had let me know, because it probably would have changed my practice a little bit. Okay. Good? Make sense? Okay. So the state exam isn't going to test your knowledge. They're not going to say, what is a normal sign of aging in the urinary system? Okay. The bladder can't hold as much urine, not as elastic. Well, the paper that I gave you will tell you that, these are some normal changes in the urinary system, but the test isn't going to ask you that question. What the test is going to ask you is, you're caring for a patient who is on the call light asking to go to the bathroom every 45 minutes. This is not new behavior. What is an appropriate action for this patient? A, take them to the bathroom when they request. B, make them hold it for longer to strengthen their bladder. C, reprimand them for wasting your time. Or D, order a urine culture and sensitivity test. What would be the right answer? So we want to take them to the bathroom when they need to go, because we have to understand that that is a normal sign of aging. Does that make sense? So we're not going to reprimand them. We're not going to make them hold it. Please don't do that. And we're not going to order a urine culture and sensitivity. That's not our role. Whose role is that? The nurse. So that's actually, even though it looks like an aging recognition question, one of the answers is there to gauge your knowledge of your role. Okay. Make sense? So when you have these questions are written at a very scientific level. They're not cut and dried. That question is asking you a whole lot more than you think it's asking you. Each one of those answers actually ties back to a different part of the test plan. A different part. So, role of the nurse aide, right? We need to know we can't order urine culture and sensitivities, not our job, right? So that's a role of the nurse aide. But one of the other ones is make them hold it. Well, that actually is all about patient rights. Does that make sense? Okay. Then we've got the right answer, and then we've got reprimand them. Well, that's never the right answer. We don't do that. That's not our role ever. So each one of those answers is actually indicating something very specific. So a lot of students ask me, how many can I miss on the state exam and still get a passing score? And the answer is it's way more complex than that. Because if every single question that you're missing ties back to resident rights, that's a problem. Or if every wrong answer that you choose ties back to the role of the nurse aide, that's a problem. Or every wrong answer that you choose ties back to safety, that's a problem. So it's not just, oh, you can miss 17 on the written test and be fine. That written test is way, way, way more scientific, more layers, deeper than you have any understanding of. The questions that I write are written in the same format. It takes me a long time to write these questions because I'm making sure that every single potential answer is going to tie back to one of those principles. Role of the nurse aide, safety, patient rights, proper procedure, and providing the right care. Does that make sense? Okay. So if you have not yet watched the game show replays, that probably should be on your list of things to do. I'll have another game show next Tuesday, a week from yesterday. So that'll give you an opportunity to see 15 test-like questions. All right, so how do we know what to do? Oh, we have a question. Good morning, Miss Patty. Thanks for all you do. I want to say here that I passed my clinical and written exam on Monday in the state of Texas. Your videos have been most helpful. Thanks again. Congratulations to you. Super proud. Great job. We're very proud of you. All right, so how do we know what to do with each patient? We follow the care plan. And it's not just the care plan, it's the whole care plan. And okay, so that means that we don't change it in any way. What happens if we can't follow the care plan? What do? Yeah, we just let the nurse know. While we're performing these tasks, what should we be making? Observations. And who do we report those observations to? The nurse. Okay. About roughly 30% of all of your written test questions are answered right here. These 4 things. About 30% of your written test with these 4 things. So when you're reading that question, you need to be thinking to yourself, is the care plan specified? If so, can I change the care plan? Because these questions are written in a way to try to convince you to change the care plan. It'll give you a reason. The patient is in bed for an extended period of time. You're asked to do range of motion on the right side. Should you also perform range of motion on the left to help prevent blood clots? Now, that to help prevent blood clots, that has no bearing on anything because we don't think, we don't plan. That is a distractor. That's actually what it's called, is a distractor, a justifier. It helps you justify changing that care plan, that action, because your brain will do this without your knowledge. It sounds reasonable. And before I taught you this, you probably would have picked that answer because it sounds reasonable. So I need you to understand that it's the care plan, the whole care plan, and nothing but the care plan, no matter what that question adds in, because that question is going to try to give you information you don't need to make you choose an action that you can't take. Does that make sense? Good? All right. So remember, this is probably the most important concept for you to grasp to pass that written test. Okay. So every skill that we're going to do starts with the opening. What does every opening start with? A knock. That's your starting point. So when your brain like fizzes out during the test and you can't remember, what do I do next? And you're just staring at the patient going, help. Every skill starts with the opening. Every opening starts with a knock. Are you guys practicing your opening in your bathroom? It should be taped to your mirror in your bathroom, the opening. And every time you walk in there, you should do the opening. And then you should also do the closing before you exit the bathroom. If you do that, this becomes second nature. You don't even have to think about it. And the test takes care of itself. Super easy. All right. Once we've knocked, we should greet the patient, right? We're going to address them by name, and we're going to introduce ourselves by name and title. Once we've done that, we're going to describe what we're there to do, and then we're going to get permission. That's right. Once we get permission, we're going to close because privacy counts. And then we now have cootied up. So what do we need to do? Wash our hands. Once we have clean hands, we can go get our supplies. Our cardinal rule here, the one we cannot break ever, is do not touch patient until your hands are clean. Why? Why is that so important? Right. So cooties, yeah, we don't want to bring them something that they don't already have. Okay. Everybody needs to keep control of their own cooties. We're not going to spread them around. All right. I watch a lot of like Discovery Health shows, and this is the one thing that makes me want to pull my hair out. How many times, if you watch any of those shows, how many times they'll be working with somebody in the hallway or transporting equipment or doing something like that, and then they walk into the patient's room and they touch the patient without washing their hands. I mean, this takes some work to get your mind around. Okay. So we also learned about gloves, figuring out when we should wear gloves. Can we wear gloves for everything without thinking? It would be easier, sure, but it's actually going to put our patient at risk because we stop paying attention to what we're touching. So if we're not going to wear gloves for everything, now we got to figure out when we need gloves. So we're going to wear gloves if we're going to touch body fluids, personal skin, or non-intact skin. If any of those three are yes, you need gloves. If any of those three are, well, maybe you need gloves. If all of those are no, you don't need gloves. You're going to wash your hands before, do your skill, and then we'll wash our hands after. If we decide that we are going to wear gloves, what is the first thing they should touch? The patient. So don't put your gloves on and then go get your supplies and get everything set up and get the towel on the patient or the privacy blanket on the bed. We want to do all of that before we put our gloves on. The gloves should be the very last thing we put on right before we start the skill. And that keeps our gloves clean for the patient. Good? Now, once you've touched the patient and your gloves are contaminated, pay attention to what you're touching in the environment. Yes, pathogens don't live very long outside of a human body. I get that. But we still don't want to cootie the place up. Okay? Good? Okay, and then if we've worn gloves, we have to know how to remove them correctly. We're going to pinch up at the base of the palm and take that one off, and then go up underneath to take the second one off. Questions? All right, so we also have barrier rules. If we're going to use supplies, we have to have a clean place to put them. So this is going to happen after we've washed our hands. We're going to go get the barrier. We're going to put it on the table, and then we're going to get our supplies and put those on the table because our supplies are clean and we can only touch supplies with clean hands. Now, when we get those supplies, we don't want to hold them up next to our uniform because our uniform is not clean once we start work. So that's why we go get the barrier first, put it on the table, go get the supplies and put those on the barrier. That way we're not holding those supplies against our uniform while we're trying to spread out that barrier. Good? Good. All right. We learned privacy blanket. We use a privacy blanket to keep the patient warm as well as provide privacy. So it does two things. It's not just about privacy, it's also about comfort. We're going to use this privacy blanket anytime the patient is uncovered or undressed. No care plan is going to tell you to use privacy blanket. It's not going to be anywhere. It's something you need to know. If we're going to use a privacy blanket, you don't want to just pull the sheet off and then put the blanket on. We want to put the blanket on over the sheet and pull that sheet down underneath so your patient remains covered throughout the whole procedure. Don't snap or shake that blanket. That aerosolizes pathogens. And then if we've worn gloves, we got to get those gloves off before we take the privacy blanket away, because you've got to touch that sheet that's going to go right up next to the patient's face. And we don't want to do that with soiled gloves. Questions? All right, we also learned linen rules. Now, linen rules are repeats mostly of what we've learned so far. One of our linen rules is that they can't touch your uniform. You have to have clean hands to get your clean linens. So during the test, this happens. This is probably one of the biggest mistakes people make on the test is, and I've gone over this a couple times, some of these skills have a lot of supplies, and you have to memorize them. And if you get, let's say, hand and nail care, we have a basin, 2 washcloths, a towel, soap, lotion, emery board, an orange stick, as well as a barrier to put all of that on. That's a lot of supplies to remember. So when you look at your care plan and you see hand and nail care and your stomach clenches because you're like, oh my gosh, that's a lot of supplies and I can't remember them all, your first instinct will probably be go get your supplies. Can you do that before the opening? No. So the order here really matters. And I know it's a lot of supplies and I know you've got to learn them. Flashcards are your friend for sure, but don't try to shortcut this, because what you're actually doing is putting your patient at risk. You're making you more important than the patient. Does that make sense? All right. So we also learned don't snap or shake linens. We know this because it aerosolizes the pathogens. Now, the next two we just learned last class. Clean rolls toward me, dirty rolls away. And we're going to see this again coming up in some other skills. We don't let anything touch the floor. Not clean, not dirty. So be careful with this, because for some of you, it's just going to be kind of habit that when you take sheets off the bed, you just throw them on the floor. Don't do that. Be very, very, very intentional. Don't put anything on the floor. Not clean. So when you're making the bed, don't let that sheet touch the floor. Not dirty. Anything dirty goes on the table or in the hamper, not the floor. Be very intentional with that. And then we also know that anything we take and we don't use, we're going to put in dirty linen. Don't leave it in the room for later. We learned scoot and roll. We learned that we're not going to have side rails in all settings to make our patients safe. The best way to make the patient safe when we're working with them is to keep them in the middle of the bed. So if we're going to turn somebody on their side, we're going to do it in 2 steps. You do it in 1. But we're going to do it in 2 when we're working with somebody else's body. We scoot them toward us, and then we roll them facing away from us so that after the roll, they're in the middle of the bed. We always turn them away from us. We remain behind the patient's behind. Don't turn a patient toward you. It's bad for body mechanics, but it's also bad for propriety. Okay? And our cardinal rule here is the patient must always be in the middle of the bed. Always. Don't rely on side rails to keep somebody safe. Side rails fail at an alarming rate. Alarming rate. And they're unsafe, but they're a lazy shortcut. There's no excuse for not having your patient in the middle of the bed. No excuse. Okay. We learned washing rules. So we don't add soap to our basins. We have to have water for rinsing. So basins are no soap zones. When we're getting water for a patient to use, we're going to use a paper towel to turn that faucet on because our hands are clean and the faucet is not. When we turn the water on, we're going to check it with the inside of our wrist. It should feel warm, not hot, not cold, just warm. We're also going to ask our patient to check the temperature. Just because I think it's comfortable doesn't mean my patient's going to agree. And we're helping them, and help isn't help if it doesn't help. If the skill takes a while and the water starts to get cold, address that. Change that water. If it gets soapy, if we put a washcloth back in it by accident that has soap on it, or if your patient has a lot of soap on their hands and they put it in there, if that water is not good for rinsing, address it. Those evaluators saw those bubbles. Address it. We got to be able to rinse it off. The order matters here. Whatever we wash, we rinse. Whatever we rinse, we dry. Don't skip steps. And you probably will when you're on the test. It's just, you'll skip one of them. So get in the habit of saying, whatever I wash, I rinse. Whatever I rinse, I dry. We've talked about this. Dry surfaces must remain dry. That means that we have to have a barrier on the table when we're working with any sort of water. Any sort of water. It's probably going to drip. And we don't want water on the table. We don't want it on the floor. That barrier is there to kind of contain any spills that might happen. If we're going to use lotion, we warm it up first and then wipe off our excess. Basin cleaning, rinse, dry, and store. That's all you got to worry about for the test. But I want you to know a process so that if you have to disinfect, we can just slide that step right in. So we're going to dump the basin. We're going to set it, rinse it. We're going to dump the rinse water wherever we dumped the basin. We're going to set it down and spray it if we need to. We'll use a paper towel to pick it up. We'll use a paper towel to dry the inside, another one to dry the outside. And then when we go to store that basin, you can't open the drawer with your dirty hands or dirty gloves. This you do have to use a barrier to open the drawer. Good?
Well, are we still clean we dry the basin with the paper towel that's with our dirty gloves?
Right. So you're holding the basin with a paper towel. You're drying the inside with a paper towel and throwing it away. You're drying the outside with a paper towel and throwing it away. And then you're getting one more paper towel to collect the supplies and open the drawer. That paper towel that's holding the basin is always there. So you're not actually holding the basin with your gloves or your hand. Okay. All right. And then the closing is something we do at the end of every skill. We're going to make sure they're in a clean and safe environment, that the bed is in the low position. We're going to ask about comfort. They need to hear this word. And we're going to address preferences. Would you like the head of the bed adjusted? Would you like a magazine? Would you like your sheet pulled up? Preferences. For the test, just use magazine. It's easy. It's easy. You're going to make sure if they're uncovered or undressed, make sure we put a sheet on them. No knobby knees. Okay. Open the curtain. We don't need it anymore at the end of the skill. Remember that closed curtains promote isolation. Isolation promotes depression. Your patients already have enough reasons to be depressed. We want that socialization, that contact with others. If the patient says, I don't want you to open the curtain, that's something that really should be reported. So you're going to open the privacy curtain. We're going to give them their call light. And once all of those things are done, we're going to go wash our hands. If we have to chart, we'll do that after hand washing. We'll document. But if we've documented, we have to go wash our hands again because our checkpoint is end skill with clean hands. Make sure your patient doesn't just feel cared for, they also feel cared about. Okay. So skills that we have learned, those are a lot of principles, guys. We only have one to go. Everything on that back wall you've already learned, except for one principle. Was it hard? Okay, so we use those principles to build skills. One of the skills that we learned was washing hands. For hand washing, we're going to wet our hands before we put soap on. We're going to get some soap and rub. You need to work up a lather, and you want to rub all surfaces for at least 20 seconds. After 20 seconds, you'll go down your nails with your thumb, your circle your fingernails on the palm of your hand, and you'll rinse. When you rinse, don't touch the sink, don't touch the faucet, just rinse, keeping your hands lower than your elbows, and then dry. However many paper towels it takes, nobody cares. Dry your hands. Water is still running. Dry your hands. Once your hands are dry, get another paper towel, clean, dry, and turn that faucet off because wet paper towels can rip and recontaminate your hands. Good? We learned how to take a pulse. A pulse is the measurement of how many times a heart beat over 1 minute. Now, this care plan is very specific. It says radial pulse measured at the wrist. There are other pulse points. We're not going to get fancy on the test. We're going to follow the care plan. So we're going to use the radial pulse at the wrist. 2 fingers, fingertips, not flat part. Fingertips over the radial pulse, thumb on the back to hold consistent pressure. You're going to pick a starting point on the clock. You're going to say start out loud. So the evaluators count when you do. You're going to count until that second hand goes all the way around, and you're going to say stop. Normal is between 60 and 100. That's what we're hoping for. You can be off by 4 beats in either direction and still be accurate, and you will have to count with the second evaluator in Florida if you have 2 evaluators. This is a documentation skill, so don't forget to chart it. We learn how to dress a resident with a weak arm. A weak arm. So in a lot of cases, you're going to be dressing people that don't have a weak arm, just get them dressed. But if they have a weak arm, we have to make some concessions here. We want to provide privacy with a privacy curtain, privacy blanket, and getting their clothes before we undress them. Don't get them naked and then walk away. That's creepy, okay? So we're going to make sure that we're providing privacy in 3 ways for this skill. We're going to lift the arm from below, or all extremities from below with a flat palm. Don't overextend or force movement. Undress strong arm first. USA first. Undress strong arm first. And then dress the weak arm first. We're going to let them choose their own clothing. And the call light is going to go in their stronger hand. We learned range of motion. We have actually learned 2 range of motion so far. So with range of motion, we need to know what body part, what exercises, and how many repetitions. Our care plan is going to provide that information. Again, we're going to lift from below with a flat palm. We're going to provide 2 points of support, and we're going to move slowly and smoothly all the way back to start. Flexion extension is up, down. Abduction, adduction is side to side. Rotation is around. There are no rotation exercises on the state exam, but you need to know that because it is one of the 3 exercises a CNA can do. Hand and nail care. This is a mini-manny. Soak the hand, take it out, wash it. Put it back in the basin to rinse, take it out to dry. Always make sure it's on a towel when it's on the table, and make sure you're providing support as you move it. After you've washed, rinsed, and dried the hand, use an orange stick to clean under the nails, wiping it off in between each nail, and then use an emery board to file the rough edges. Warm your lotion up, put it on, and wipe off the excess. That's hand and nail care. Making an occupied bed. We're going to make the bed a half at a time. So remember, clean rolls toward me, dirty rolls away. So we have to have our patient on their side in the middle of the bed. So we're going to use that whole scoot and roll thing to get them in the middle of the bed. Loosen the sheet on this side, roll it toward the patient, tuck it under them. Put the new sheet on, secure the corners, roll it towards you, and tuck that under the dirty. Go over to the other side of the bed, repeat the process. We'll put a top sheet on, make those hospital corners so the corners aren't on the ground, change the pillowcase, make sure we're limiting the amount of time they don't have a pillow. It's uncomfortable. And don't hold anything up next to you or put it on the floor during the skill. That's making an occupied bed.
Can you explain it once again, like how do you do the bed? Like how do you put on the covers on the bed? Like once again.
So,
Sheets on the bed, yeah.
so you want me to explain how to do this again?
Yeah.
Are you talking about the bottom sheet or the top sheet?
The new one, how do you do it? When the new one in, the dirty one hot.
Okay, so we have a patient laying in bed. They're on their back. They're taking up way too much of the bed. So I'm going to scoot the patient toward me and roll them on their side so they're taking up less of the space. I'm going to loosen these two corners that I'm standing next to, patients on their side, loosen these two corners, and I'm going to roll that sheet up toward the patient. I'm going to tuck it as far under them as I can get it. Now I've got a bare mattress. We don't want the patient on the bare mattress. So I'm going to take my new sheet, unfold it, stretch it out, and connect these two corners. I'm going to roll that one toward me and put it underneath the dirty one. So now there's a sheet on the bed. There's half of it is dirty, half of it is clean. So I'm going to put my patient back on their back and go around to the other side of the bed. Scoot them toward me, roll them up away, take the dirty sheet away, put it in the hamper, smooth the clean sheet out, connect the corners, put them back on their back, put a top sheet on, tuck the bottom in, change the pillowcase. Okay. Yeah. The video shows really good close-ups of each step, which will help you. But the biggest thing on this is to make sure that, number one, your patient is on their side while you're trying to do this. Number two, make sure that the patient is never on the bare mattress. Yes, that is a test. Everything that I show you in here is a tested skill. That means that you may be required to perform that skill, except for blood pressure. We learned blood pressure last class, but that you will not have to demonstrate. Everything else in here is a tested skill. Okay. But remember that out of the 20 skills we're learning, you only have to do 3. You don't know which 3. You have to learn them all, but you're only going to have to perform 3. So you may not get occupied bed at all. The evaluators, when you go take the state exam. Now, you will have practice time in here. The first 2 weeks, you have no practice time. I'm talking nonstop. I've got too much to tell you. So the first 2 weeks, no practice time. Starting on Monday, you may have about 15 minutes at the end of class, not much. Next Wednesday, a week from today, you're going to have about 45 minutes to an hour. Monday, you'll have about 45 minutes to an hour at the end of class. The last day of class, you'll have about 2 hours of practice time. And then the week after that, you've got all class time, Mondays and Wednesdays from 9 to 1. You have to be able to sign up and come in and practice. So there is practice time built in, but not in the first 2 weeks. I got to give you something to build on first. Okay, good? Questions? Look how much you've learned. It took us 40 minutes to go over everything that you've learned over the last 3 class periods. It's a lot of information, guys, a lot of information. Now, we will have this review in class 5, 6, and I even think I put one in 7 as well. But they're going to be shorter reviews. I'm not going to ask you, I'm just going to move through them. But I want you to know that at the beginning of each class, you will have a review so that toward the end of the program, when you're, oh my gosh, I can't remember what she said about this, go to the first 20, 30 minutes and I'll do a comprehensive review for you. Okay, good. All right, so when you're looking at all of these principles, there's only one we haven't covered. We've learned everything else. Great job. Remember that the yellow testing care plan set is up here for you guys to refer back to. This is what it looks like. If you want your own copy, you can purchase it. We also have the little pocket cards that are available to you as well. This is the same information on page 25 in your book. It's just a little bit easier format for you to be able to use for practice. It's also included, this card set is included in the practice kits. All right, so let's get into today's lesson. So page 138 is where we're going to start. This is change position to supported side lying. That means we're going to turn a patient over onto their side and use some pillows to prop them there. Supported side lying. Supported simply means that they need some help to stay on their side. Gravity will always try to pull you back onto your back. Always. That's just gravity's job. It doesn't normally pull you onto your stomach because of the weight distribution in our body. It pulls us onto our back. So if we have somebody that can't really keep themselves on their side very well, we're going to use some pillows or rolled blankets or something to help keep them in that position. That's what that term supported means. If you look down the side there, you can see all the principles that are involved in this skill. They're all spelled out for us here on the page. We already know all of these. We just went over every single one of them. Test-specific steps are there. I have a video, and down here's your testing information. So somebody with your level of experience, none, should be able to do this skill in 8 minutes or less. Guys, you're putting somebody on their side and propping them there with pillows. Not a long skill. If I got to choose my skill, this would be one that I would choose. Okay? This actually counts as a mobility skill because we're moving a patient. This is going to be done on a live testing student, so you might be a patient for this, and that person will start the skill in the bed. So if you look on page 139, up at the top of the page, you can see the care plan. This is the care plan you would get on the state exam, along with step-by-step instructions that tells you exactly how to do this skill. Down at the bottom, you see your supplies. Here's our care plan. It says position the resident on his left side. Now it's specifying left side. So if you go through this whole skill and the patient ends up on his right side, did you follow the care plan? What happens to your score if you're not following the care plan? That's right. So this matters. Pay attention. Your care plan for the test could say left. It could say right. Read the care plan. It says patient requires support to remain on his side and is unable to assist with turning. Here's the problem with your brains. When you read that, the patient is unable to assist with turning, about half of you automatically made this patient into a paraplegic or quadriplegic or stroke patient, somehow paralyzed. They can't do anything. That's not what it says. That is not what it says. It says unable to assist with turning. It doesn't say that the patient can't move on their own. So be really careful not to let your brain change the care plan. If this patient cannot roll over on their own, it doesn't mean they're paralyzed. This patient may have had abdominal surgery where we cut everything up, took everything out, fixed what needed to be fixed, put everything back in and sewed them up. So now they've got this big old incision down their abdominal muscles. This patient's not going to be able to roll. Their abdominal muscles aren't even talking at this point. But that doesn't mean that they can't scoot their body over. It doesn't mean they can't move their legs or their arms. It just means they can't roll. So be really, really careful not to attribute conditions to your patient that they don't have. Does that make sense? Good. All right. So we know all the principles that we need to know to do this. We know to read the care plan. Patient needs to be on his left side. We know to do our opening. We know to evaluate if we need gloves. Now, let's time out here on gloves for just a second. I told you that one of you guys would be a patient for this. You plan on being fully clothed for the test? Yes. And you're holding on to all of your own body fluids like a champ. So for the test, you, the patient, are not a risk. So the person performing the skill does not need gloves to do this. Make sense? Okay. In a clinical setting, if your patient is undressed, do you need gloves? In a clinical setting, if your patient is leaking something from somewhere, do you need gloves? If your patient is fully clothed and holding onto all their own body fluids, do you need gloves? Okay. So we've got to use some discernment here as to whether gloves are required. This patient is going to be uncovered during this skill because we've got to get to their legs. So we probably want to use a privacy blanket. You don't have to, but you probably should. You can keep the sheet on the patient for the skill. You can, and use that to keep them covered. But it's really hard to get a pillow between their legs when there's a sheet over the whole body. So if you use a privacy blanket, just makes it a little bit easier because now you can just kind of move the blanket up and you've got free access to the legs. Okay, good. Makes sense. All right, linen rules apply. Linen rules mean that we have to have clean hands to get our linens. We're not going to snap or shake them, and we're not going to hold them against our uniform, and anything we take and don't use, we're going to discard. We know to keep the patient in the middle of the bed. That's important. So after this skill is over, you've scooted the patient towards you, you've rolled them on their side, you've propped them there with pillows. I want you to take a step back and look at your patient. Take a step back and look at the patient. If that patient looks like they're too close to the edge of the bed, you need to address that. I want you to think for just a second if you were the patient. If you were unable to prevent yourself from rolling onto the floor and you were positioned close to the edge of the bed, and you knew that if I start rolling, it's all over, how much rest would you get? None. You're going to be continuously on edge. That actually will affect healing. There's a physiological response to psychological stress. Do you guys understand that? Those two are tied together. So at the end of this skill, I want you to just kind of take a step back and look at the patient. Do they look like they're too close to the edge of the bed? Do they look uncomfortable? Do they look scared? If the answer is yes to any of them, redo it. Scoot them closer toward you or toward the bed. Very important because that is what the evaluator is grading on. That's what's going to make or break this skill is where is the patient at the end of the skill. Make sense?
Will that be greater if they accidentally they touch our scrubs without we're supporting them to scoot over and roll? What if accidentally they touch our linens?
That's fine. We just don't want the clean linen. We know our scrubs are unclean. We know that we're going to touch patients. We know we're going to kneel on the floor. We know we're going to touch a lot of unclean things. We just don't want those clean items to be held right up against our uniform. Okay. This skill, you have to get 3 pillows. And in the test, every testing center is set up a little bit differently. Some is set up like this, like a cube system where the pillows are near the bottom. That's way easier, right? Because we can just take them out and put them on our table. Some have those taller shelving units where the pillows are at the very top and you have to pull them down. Well, again, don't hug those pillows. Okay, just pull them down and then put them on your table. These are just small things that we want to be aware of. Okay, good. And we know to do our closing because that's at the end of every single skill. We never can get away with not doing the closing. So let's focus on the skill-specific steps for this particular skill, right? We know we're going to do skill rules, opening, glove rules, barrier, privacy blanket, linen rules, scoot and close, and the closing. Let's look at the other steps that are specific to this skill. Now, I told you that this patient is not immobile. Our care plan does not tell us this patient is immobile, but I do want to take just a moment to talk about immobility, because you will have some patients that are immobile, and it's important that you kind of understand a little bit about what that means. Immobile patients cannot move on their own. Okay, immobile means they cannot move on their own. Is this patient going to be able to take care of their own bathroom needs? Is this patient going to be able to take care of their mouth care needs? Is this patient going to be able to feed themselves? So immobility means we do everything. This is also called total care. Total care. Immobile patients take a lot of time, a lot of care. And in general, the nurses are the ones that make up the patient care assignments. So if I've got all of you guys working with me at a facility and I'm taking care of 30 patients and I give each one of you a certain number of patients to take care of, I'm not going to give one of you all total care patients. It just takes too much time. So I would give you one total care patient, one that needs some, a lot of assistance, and then 2 or 3 that just need reminders or little bits of help. So we try to group assignments so that it's fairly spread out as far as the workload goes. If you and I are not getting along, and I'm the one that's responsible for making your assignment, I'm likely to give you hard assignments. It is not in your best interest to work against the nurse. Now, I would like to tell you that nurses are fair-minded individuals and they'll never take out their, emotional conflicts on you. That is not reality. If you make somebody mad, they're probably going to react. So try to work with your nurse, not against them, okay? But in general, we try to break up the total care patients among multiple staff members. If you do get a lot of total care patients, you probably can only take care of 2, maybe 3, period, because they take up so much time and so much care. And one of the things that we're going to learn about is how often they have to be repositioned. It's something we're going to learn about here in just a minute. But immobile patients can't do anything for themselves. But the problem with immobility is that it affects every single body system. Every body system is affected. It's going to slow down digestion. And something that a lot of people don't realize is that food doesn't move through your digestive system on its own. When you eat, your small intestines, it's called smooth muscle, it kind of inches food along, but it doesn't do that well on its own. It actually relies on our skeletal muscles, our abdominal muscles. When we sit up, when we change position, when we roll over, when we walk, when we breathe, our abdominal muscles move. That movement of the external muscle actually moves the internal smooth muscle. So if we have a patient who is immobile, that food is just going to kind of sit there and not move through their digestive system very well. Does that make sense? What do you think that's going to contribute to? What condition might they develop? Constipation. That's right. That's right. And this stuff can turn to like cement. So digestion is affected when your patient is immobile. Lung volume and elasticity is affected. So again, we've got a muscle at the bottom of our lungs called the diaphragm, and the diaphragm contracts and pushes up for you to exhale. It relaxes and sinks down for you to inhale. Well, if you're not moving and our lungs don't have any reason to take a deep breath, that muscle doesn't get a workout and it gets really floppy. And now your patient isn't breathing very deep. And that's going to affect oxygenation status. Make sense? Good. It also is going to decrease bone density. A lot of people don't think about this, but we have to have activity and weight bearing to keep our bones in tip-top shape. If we don't have good exercise, your bones become porous. Now, if this patient falls, what's likely to happen? Yeah, we're going to get a fracture. Absolutely. We can get muscle atrophy. This is the one thing that most people do realize with immobility. The muscles tend to shrink because they're not being used. It's not just skeletal muscle, though. It's every muscle in the body, including your heart muscle. Doesn't work as effectively. So now we've got cardiac implications here. It also decreases immune response. Our patient, this has to do with that whole bone density thing because your blood cells are made inside your bone marrow. So if your bones aren't very strong, your blood cells aren't going to be very strong. And we're going to stop making a lot of the cells that we need for immune response. Well, if we have an immobile patient in a pathogen-rich environment and a limited immune response, that could be a problem for our patient. Good. So we got to make sure that we're paying real close attention to those techniques that we use to limit the amount of pathogen transfer. And it's going to affect cognitive function. The brain just slows down. It doesn't think as clearly, brain fog. It's just every body system is affected. But the one that's affected the most, now those do not sound like good things, do they? No, immobility is bad. This is why we try to get our patients up. We don't want to put patients in a bed, put the side rails up and leave them to rot. We want to get them up out of bed, walking, in a chair, work on their mobility, just different positions, work those muscles. And that will help prevent a lot of these complications. But the one organ that is affected way more than any of those, and those are bad, but the one organ that is really affected is the skin. With immobility, skin is going to be horribly affected. Now, I'm going to give you an illustration of this, and I need you to play along. I want you to take one of your hands and put it underneath your leg or your backside. I want you to sit on one of your hands. I am going to ask you to take it out in 2 minutes, but play along with me. Okay, just play along with me. 2 minutes. When you are laying down and you're immobile, you're going to have different areas of pressure. And it's basically anywhere the bone is pressing down on the skin. So the back of the head, the shoulder blades, the hips, moving, down the back, the bottom of the body, everywhere where a bone is being pulled down onto skin and surface. All of these are potential pressure areas. Now, it doesn't take long for there to be an effect here. When you have a bone that's pressing down on muscle and blood vessels and eventually skin, that's gravity, right? Gravity is pulling heavy things down. What that's going to do is actually your blood vessels are kind of toward the bottom of this, right, near your skin. It compresses those blood vessels, right, as everything gets pulled down. It pinches them off, and that means that we're not going to get good blood flow to these areas. What happens to cells without good blood flow? Yeah, they die. So now we have a situation where this prolonged pressure is causing cells to die. Now, this is exacerbated, it's made worse if the area that that skin is contacting is not flat and smooth. If that area has wrinkles, those wrinkles are going to add an extra layer of pressure pushing up. So we have bone and muscle and fat pressing down. You've got wrinkles pressing up, and what's trapped in between the two? The skin. Now, this is where we end up with pressure sores because the cells die and the skin starts to separate. And those wrinkles can actually cut into the skin, especially if they're left in that position for a long time. So go ahead and take your hand out, and I want you to look at it. Look really closely. Do you see color changes? Now look really, really closely. Can you see the pattern of your clothing or the chair imprinted in your skin? Can you see the actual pattern? Anybody see that?
I mean, like my veins darker.
Okay. So what that is, that was 2 minutes, guys. That was just 2 minutes. Oh. That was just 2 minutes. Imagine how deep those lines would get after 24 hours. If 2 minutes gave you lines, if you didn't move your hand over hours and hours and hours, if you couldn't move your hand over hours and hours and hours, those lines don't go away. They get deeper and deeper and deeper and deeper, and eventually they will cut the skin. And that is called a pressure area, a pressure sore. Does that make sense? So if we have a patient who is immobile, we can't leave them there for hours and hours and hours and hours. If they can't move themselves, it now becomes our job to move them. Now, you do this yourself all the time. When you go to bed at night and you lay down, you don't wake up in the exact same position that you went to sleep in. You don't go to sleep and stay in that position. You toss and you turn. Now, the reason that you toss and you turn is because of this. When you stay in one position for too long and gravity is pulling those muscles and bones down, your skin starts to scream. It says, hey, brain, this is uncomfortable. I need blood flow. And your brain says, turn, toss, stretch, move. And this is why you're constantly moving when you're sleeping. Make sense? It's also why you guys can't sit still in the chairs. You will bounce your leg. You will shift your position. You will lean to the side and then you'll sit back up. You are shifting your position all the time in little micro bursts of movement. And that's designed specifically, that's designed specifically to restore blood flow to those areas so we can prevent cell death. Does that make sense? Okay. So if our patients can't do that on their own, if they can't move on their own, that becomes our job to understand this mechanism and make sure that we are taking the steps that we need to prevent the breakdown of that muscle and tissue. So when our patients are immobile, we need to change their position. I just talked about that. Generally speaking, this is going to be done every 2 hours around the clock. Every 2 hours around the clock. So some care plans may actually ask you to change the position every hour around the clock, depending on the needs of the patient. But 2 hours is kind of our benchmark, our standard. If we have an immobile patient, we're going to do this on something called a turning schedule or a turning clock. And you might actually see this on the wall over your patient's bed or near the patient. If you don't have one, you can make one. This is certainly within the bounds of a CNA to be able to make as a turning clock. So we're going to have our patient on their back for 2 hours, and then we're going to turn them on their right side for 2 hours. The next 2 hours will be back on their back, and then left side, and then back, and then right side, and then back, and then left side every 2 hours. Now, if I have a turning clock on the wall and I walk in the patient's room at 3 p.m., I can look at that clock, 3 p.m., and my patient should be on their back. I can then look at the patient and see, are they on their back? If they are, then I know that my CNAs are following the turning clock. It's a great way to provide checks and balances because you might get busy and not have the opportunity to get in there and change the patient's position. If I see that the position needs to be changed, then I can do that. Make sense? Kind of keeps everybody on the same page. So back, right side, back, left side, back, right side, back, left side. Never on their stomach. Unless the care plan very specifically tells you, hey, tells you to put the patient on their stomach, we don't do that. That's because if you place somebody, remember all of that pressure pulling down, right? Gravity's pulling everything down. When you put somebody on their stomach, if they are truly immobile, they may not have the muscle strength or the nerve innervation to pull themselves off of their chest cavity for their lungs to inflate, and we can suffocate them. So we don't put a patient on their stomach unless the care plan specifically tells us to do so. Now, what I found very interesting during COVID, now this is a nursing principle, nurses all know this. You know, if patient's immobile, side or back. What I found very interesting during COVID is there was a nurse in the ICU that turned the patient, what we call prone, right, on their stomach, and used some straps to kind of keep them there. And they actually found that they oxygenated much better using the anterior portions of their lungs versus the posterior portion. And the recovery from COVID on patients on ventilators was reduced. So again, we're going to follow those care plans because they're going to be specific to that patient. If I've got a patient with a fractured neck, we're not putting them on their stomach. So 2 immobile patients, 2 different outcomes. Make sense? This is why we can't treat everybody exactly the same. So we're going to use our scoot and roll rule here. Patients must be in the middle of the bed. So if I'm going to turn our patient, we're going to scoot them toward us, turn them on their side, and I'm going to prop them there with pillows. But after the turn, I've got to make sure that they are in the middle of the bed. The evaluator is paying attention to this. If the patient is too close to the edge of the bed, they're not going to be able to relax or rest. So pay attention to that. Remember that we're going to scoot them toward us so they're in the middle after the turn. Now, for this skill, it says our patient cannot turn. Doesn't say they cannot move. So for the test, you can ask the patient, can you scoot toward me? Nothing wrong with that. If in a clinical setting, your patient can't scoot toward you, if they are immobile, you can use a couple of different methods to scoot them toward you before you roll them. You can use something called a draw sheet. Draw sheet is nothing more than a flat sheet, a top sheet, folded in half lengthwise. Not like this. It's folded like this. And we put this under the patient with the folded edge between their shoulders and the 2, what we call the selvage edge, the parts that fold over under their legs. So this goes under the patient like this, and it actually becomes a sling. And I use it as a sling to pull the body weight toward me. And because it's between the shoulders and the thighs, that's the majority of the patient's body weight. Me alone, I can move that patient closer to me and then roll them on their side. So draw sheets can be utilized to help move patients in bed. You can also move the patient using the segment method. Head and shoulders, upper chest, torso, legs, feet. You can also use something called a slide sheet if your facility has one. Slide sheets are amazing. They're like NASA technology, and they're incredibly expensive. So this is probably locked up in a supervisor's office somewhere, and you got to sign it out and promise your firstborn if you don't return it type thing. But a slide sheet, it's not wet, but it's as slippery as a slip and slide. It's not wet though. If you put it under the patient, remember clean rolls toward me, right? We roll the patient toward, or we roll the slide sheet toward us and put it under the patient. It almost levitates the patient so you can scoot them closer to you. It's really amazing technology. Your facility may or may not have one. How would I know which method to use with this patient? Okay, ask the nurse or consult the care plan. Yep. If I have a patient with burns, we're not sliding them. If I have a patient with compression fractures, I don't want to move them in segments because that can displace that fracture and cause paralysis. So we want to follow the instructions outlined in the care plan. If the care plan doesn't specify, just ask the nurse. Any guidance? If it's not in the care plan, they'll say, no, just move them. It's fine. All right. So we've got the patient scooted closer to us. We're getting ready to turn them. Now, if I just walk up to a bed and try to turn a human on their side, I'm not going to get very far because they're floppy. It doesn't work very well. It's going to take a lot of energy from me. I don't want to spend that much energy. I got a lot to do today. I don't want to spend that much energy. So what I'm going to do is prep the patient properly for the turn. And if you do this, you can turn somebody 3 times your body weight with no stress on you or them. It's amazing. But a lot of people go into this thinking they're just going to like put a hand on the shoulder and a hand on the hip and manhandle them over. And that doesn't work. You have to prep them first. Now, the way that we do this, the first thing you need to know is which side are we turning the patient to. Remember, this patient has to end up on their left side. Now, we also know, we've learned that we remain behind the patient's behind. So if I'm going to turn this patient so they're on their left side, which in this case is coming toward me, which side of the bed do I need to be on? The right side of the bed. Everybody got that? Everybody good with that? Okay. It's very important that you understand that concept. So I would be on that side of the bed, scoot the patient toward me, and then I'm going to roll them facing away from me, but I need to prep them first. So the reason you need to know which side of the bed you need to be on is because we're going to use the term furthest and closest. So if I'm on that side of the bed to turn the patient on their left side, I'm going to take their furthest arm and put it over their head. Closest arm is going to cross their chest like this. Now, if I were going to turn them on their right side, I would be on this side of the bed and furthest arm would be up, closest arm would be crossed. So it depends on which way you're turning them. Furthest arm up, closest arm crosses. Good? Right. Furthest arm up, closest arm crosses. Everybody go with the top part of the body. Let's move on to the legs. So the closest knee to me, in this case, it would be the right knee, is going to be bent with a foot flat on the bed. Okay, so I'm going to bend that knee up and put the foot on the bed. The furthest knee is going to be bent as well, but angled out. So your patient is going to be laying in bed with one knee up, one knee bent out, one arm up, and the other arm crossed. When you get them in this position, it takes no work to just roll them over because they're already halfway on their side by positioning them this way. Make sense? So in this situation, your prep work is the hard part. When you learn how to do this, you got to be careful because you've got this patient already half on their side. If you go into this with a lot of oomph and force, you'll roll the patient right over. So you're going to have to practice this one just so that you can see it's way easier to turn this patient than you think it's going to be. Way easier when you have them positioned properly. A long, long time ago, I worked with bariatric patients. It's different than geriatric. Geriatric is elderly. Bariatric is the morbidly obese. And I would take care of them before they would go for their weight loss surgeries. And a lot of these people were bedbound just because of the weight that they carried. Their bodies couldn't support their weight standing up. So one of the things that I would have to do is change their positions. So I can turn somebody that's about 600 pounds as long as I position them properly. It doesn't take a lot of force or strength once you have them in the right position. Good? Questions?
So we're doing this after we pulling them, scooting them towards us, and then we're doing that, and then roll them.
And then rolling them, right.
Okay.
Right. So scoot toward me, prep the patient, and roll away. All right. So once you get the patient in the right configuration for turning, we're going to help them turn. But when we do this, we want to make sure that we're keeping them a safe distance from the edge of the bed at all times. That is a graded checkpoint, and that's the one that really counts for this particular skill. They don't want that patient too close to the edge of the bed. So we're going to roll that patient away from you gently. And then we're going to keep them in that position using a pillow behind the back. Now, this pillow is going to be in a roll behind the back. The way that I do that is I tuck one long edge of the pillow underneath the patient's back, as far under the back as because I need it to be held in place. And then I take the other edge that's kind of sticking up at me. I roll it and then tuck that under the patient as well. And we end up with a pillow and a roll behind the back. And that just keeps them from being able to roll back onto their back, keeps them in that position. Good. Once we have the back secured, then we're going to place a pillow between their legs. Now, the top leg needs to be, we don't want the top leg right on top of the bottom leg. That's why we kind of angle it out a little bit. We don't want it right on top because those bones are going to rub together. We want that top leg just a little bit off, okay, to make it more comfortable. And I'm going to put a pillow in between. That pillow should specifically pad the knees and the ankles. We don't want those bones rubbing together. We don't want consistent pressure over those bones. So we're going to put the pillow between the legs, between the knees and the ankles, making sure that top leg's just a little offset. Then we're going to place a pillow under the top arm. This pillow is doing way more work than you think it is. When you lay down on your side and your arm kind of falls forward, that puts a lot of pressure along your neck and upper back area. And prolonged pressure can cause muscle spasms. It can cause weakness. It can cause numbness and tingling. And it can even cause headaches. So we put a pillow underneath that top arm, between the top arm and the body, to hold that arm in a neutral position. It helps relieve a lot of that pressure along the neck and upper back. You want to make sure that the pillow is under the arm, not over the face. So take a minute when you're putting that pillow underneath that arm, making sure it's under the elbow and wrist, but position it in such a way that it's not covering the face. They are looking for that. And then the last pillow that we're going to be addressing is the one that's already under the head. You want to make sure that that pillow, when you turn that patient on their side, that pillow is probably under the shoulder. It's just because of the way our heads are on our pillows. When we turn, that pillow can be under the shoulder. We don't want that. We want to adjust that pillow so it's just under the head and the neck, not that. We don't want that shoulder scrunched up. Okay. Once, make sure that nothing is off the bed. So no legs are off the bed, no arms are hanging off the bed. Everything is kind of tucked in there. And then we're going to put the call light in the bottom hand, the one that's under the pillow. We don't want that call light cord to stretch across the patient's neck. That's a choking hazard. So the pillow gets looped up and around and in that bottom hand that's under the pillow. Okay. Good? So let's see how we're going to use all of these principles to get all of the check marks for this skill. We're going to follow our care plan. No, we're not on break. We're going to follow our care plan. We're going to do our opening. We're going to evaluate if we need gloves. We're going to use a privacy blanket. We're going to maintain linen rules. We're going to make sure our patient's always in the middle of the bed, not near the edge, using scoot and roll. We're going to follow our skills-specific steps and then do our closing. And if we do all of those things, we get all of these check marks. Remember that this care plan is just for this patient. Different care plans will be different for different patients. So this patient can turn on their own. Not all patients can. We're going to follow our care plan. Remember that for the test, you have 8 minutes that they think you should be able to do this skill in. That doesn't count your hand washing, by the way, and it doesn't count any thinking time. That's just, they're going to give you 8 minutes to do this skill. The video that we're about to see is less than 8 minutes, and I've got the whole intro sequence and credits at the end. So there's plenty of time to do this skill. Don't rush. Okay? All right, Jake, can you put up sideline position for us? Good morning, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I need to turn you onto your left side and use some pillows to secure your position. Is that okay?
Yes.
Okay, I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. Now that I have clean hands, I'll get clean supplies. We're going to start with a barrier, and we'll place it on the overbed table. And this gives us a clean place to put our clean supplies. Now I'll get 3 pillows. And a privacy blanket. We'll bring this over to the side of the bed. Okay, Mr. Jones, I'm going to start with a privacy blanket. I'll place this on top of you to help protect your privacy and to keep you warm while we do this skill. So I'll take the privacy blanket and unfold it, being careful not to snap it or shake it. We'll lay it right over the patient on top of the sheet. Can you hold that for me? Thank you. I'm going to pull the sheet all the way down to the end of the bed. This just gets that sheet out of our way. Okay, Mr. Jones, can you scoot your body toward me? Thank you. Now I'm going to position you for the turn. So we're going to take the furthest arm and place it up over the head. The closest arm will cross the chest. The closest knee is going to bend with the foot flat on the bed. And then the furthest knee will angle out. Okay, just relax for me. Thank you. And now I'm going to roll you on your side on the count of 3. 1, 2, 3. So I'll roll the patient, maintaining a wide base of support. And then I'll use some pillows to keep him in this position. So the first pillow will go behind the back. We're going to move the privacy blanket out of our way so we don't tuck it in. The first pillow will go behind the back. We're going to tuck this edge underneath the patient. So I'm going to tuck down and under. This edge will roll up and then under the patient, down and under. And that provides a nice roll. We'll go to the other side of the bed. So this pillow will go between the legs, specifically between the knees and the ankles. We don't want the legs to lay right on top of each other, so I'm going to move the top leg just a little bit forward, and then I'll lift from below and place the pillow in between the legs. That way they're not laying right on top of each other, and the bony prominences are separated by the pillow. We'll cover the patient up. I'm going to take the third pillow, and this one will go underneath this top arm. As the arm droops down, this puts a lot of pressure along the upper back and into the neck. We need that arm in a neutral position. So I'll take the pillow, lift the arm from below, and place the pillow right under the elbow area of that top arm. Now the pillow under the head is under the bottom shoulder. So we're going to lift the head up, move the pillow so that it's only supporting the head and neck, and then we'll place that bottom arm underneath the pillow. We're going to take the call light and place it directly in that bottom hand. Okay, Mr. Jones, I'm going to remove the blanket and pull the sheet up now. So we'll pull the sheet right up over the blanket and the pillows, and then remove that privacy blanket, rolling it into a ball as we remove it so that trailing edges don't contaminate other surfaces. We'll adjust the sheet for neatness and appearance. And we'll open the privacy curtain. Mr. Jones, are you comfortable?
Yes.
Okay, I'm going to go dispose of my linens and I'll be right back. This will go into dirty linen. We'll dispose of the barrier in the trash can. And we'll move the tray table back to storage. Okay, Mr. Jones, is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes, ma'am.
Okay. Is the head of the bed, does it need to be adjusted at all?
No, thank you.
Your environment is clean. Bed is in the low position. I'm going to go wash my hands. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done. Okay, so the question was, are we doing this for immobile patients? And the answer is we're doing this for any patient that care plan tells us to. They may be immobile. Maybe they have a fracture and can't move on their own. Maybe they've had a stroke. Maybe they're just recovering from surgery or from a virus that made them super, super, super weak. We're going to do this technique for anybody the care plan tells us to. Good? Any other questions? Okay. All right, so we're going to go ahead and take our break now. The next skill that we're going to get into is foot care. Do you guys remember hand and nail care? Foot care is just like hand and nail care, just on the foot rather than the hand. And we don't do anything with the nails themselves. Where hand and nail care, we cleaned under the nails and we filed them. We don't do that with foot care. We just wash, rinse, dry, but the main thing we're going to do here is look. So the skill itself is pretty easy. You already know most of the steps. We are going to talk about a couple of things, though, related to this skill before I show it to you. And then we're going to do mouth care. It's brushing teeth. You guys all know how to brush teeth. There's not a whole lot to teach you on that. After we do those two skills, so we're going to get those done pretty quickly, then we're going to get into the test registration. So I'm going to give you the test registration packet and we're going to fill it out together in class, and you will register for the test when you are ready to register. But you can use that as a template so you know exactly what to put in the online registration if you want to do an online registration, or you can simply mail that packet in because it'll already be completed. That takes about 45 minutes to an hour of our time. The registration packet is very, very complex. So we're going to spend a lot of time on that, and I'll make sure that all of your questions are answered. So let's go ahead and get our break out of the way, and then we'll get into the last two skills, okay? You guys ready? Okay, let's go to page 118. This is going to show us our overview of foot care. It's going to have our principles down the side along with the skills-specific principle. All the principles are spelled out for us there on the page. At the bottom of the page, you can see your test-specific information. So somebody with your level of experience should be able to do this skill in 13 minutes or less. It's a long time, guys. This is a live patient skill, which means that one of you may be a patient for this skill. And I know no one likes having their feet messed with. I get it. But during the test, this is a skill that has to be demonstrated. So use it as an excuse to go get a pedicure before your test. Okay. Your care plan is going to be located at the top of page 119, along with step-by-step instructions, and your supplies are located at the bottom of the page. Let's take a look at this care plan in detail. It says provide foot care to 1 foot. Let's stop there for a second. How many are we washing here? What if the patient has 2 feet? Don't care. We're only going to do 1. For the test, it's not going to specify which one. And the evaluator may not give you any specific instructions, and you get to pick which foot do you want to do. But if the patient has an issue with one of their feet, then the evaluator may give you verbal instructions, perform foot care on the left foot. Listen to the evaluator, follow their instructions, okay? But for the most part, 99% of the time, you get to pick one. Now, it goes on to say with soap and water. So it's going to tell us how to do foot care with soap and water. We're just going to wash the foot. The resident is sitting in a chair and their sock and shoe should be replaced at the end of the skill. I'm going to time out here for just a second. Let me explain this. Most of your care plans will not say this. In a clinical setting, when you do foot care, you're going to put clean socks on the patient after foot care. Clean body parts require clean clothing. It's just kind of a principle we all know. The problem is that if you were the patient for this skill, you probably don't have a spare set of socks in your pocket. And the evaluator doesn't have extra socks just laying around to hand out. So for the test, your care plan is going to be very specific. It's going to tell you to replace the patient's sock and shoe at the end of the skill. That means, remember, you have to have closed-toed shoes on to test. Remember we talked about that? They don't care what else you wear, but you have to have closed-toed shoes on. And presumably, you've also got socks on as well. Do not wear Crocs, things without a back, to the test. Make sure that it's, covers your foot. You should also wear socks. But let's just say that you decide to wear Crocs to the test, the ones with the holes in them, and you're barefoot in your Crocs, so no socks. You will not be a patient for this skill. Make sense? Because we need that sock to be able to perform this skill. Right. In a hospital setting, a nursing home setting, an assisted living setting, you're going to put clean socks on the patient after completing this skill. What they're looking for is that you remove the wrinkles from the socks and the toe seams are across the toes. So put the sock on correctly. That's all. Why would wrinkles be a problem?
It hurts the skin.
Okay, it hurts our skin. It also provides an extra area of pressure. Okay. We already know all the principles we need to know to do the skill. We're going to follow the care plan, do our opening. We'll use a barrier. This skill, you will use gloves. And the reason you're going to use gloves, first of all, it's feet. Nobody wants to touch feet. I get that. But the real reason that you're using gloves is because of why we're doing foot care. We're not doing foot care to clean the foot. That's not why you're there. You are doing foot care to look at the foot, because usually feet are covered in socks and shoes, and we, have no idea what the skin underneath those socks and shoes are actually doing. So they've assigned you to do foot care so that at least twice a week, somebody is looking at that skin and making sure there's no wounds or sores or rashes, making sure the toenails don't need addressed. We're looking for a problem. Okay. Make sense? All right. So because we don't know if there's a problem, there's a maybe there, we need gloves. We're going to use a barrier for this skill, but that's going to go on the floor, not the table, because that's where we're working. We know linen rules, we know washing rules, and we're going to clean the basin the way we clean all basins. And we know to do the closing. So there's nothing new here that we need to learn to do this skill other than our skill-specific steps. But let's look at that care plan one more time, guys. It's telling us to wash 1 foot with soap and water, and they're giving us 13 minutes to get that done. That's an incredible amount of time to wash 1 foot. Don't rush this one. The hardest part of this skill is that you have to be on the floor. You're going to have to kneel on the floor to be able to wash the foot. Now, I wish that testing centers had those little rolling pedicure stools. That would be ideal. They don't. You actually have to get on the floor. If you want to put a barrier down on the floor for you to kneel on, you can do that. If you have knee problems and you want to put a towel on that barrier for a softer surface, you can do that. None of that is graded. They don't care whether you do or don't. None of that is graded. But you can take some steps to make this a little more comfortable for you if you need to. Good? Good? All right, so these 2 skills are very, very similar. With hand and nail care, we supported the hand when we moved it. We're going to support the foot. With hand and nail care, we soak the hand in water. We're going to do that with the foot. With hand and nail care, we made sure that we placed the hand on a towel when it wasn't in the basin. We're going to do that with the foot. Now, what we're not going to do is clean under the nails or file the rough edges. We're not going to do that, but we are going to put lotion on. So again, we're going to warm that up and wipe off the excess. So these 2 skills are very, very similar. Foot care is actually a little bit easier because there's things that we're not going to do. But we are going to put the shoe and sock on. That's something that we didn't have to do with hand and nail care. All right. So our checkpoints here is that we're going to soak the foot in the basin of water. So we're going to put the barrier on the floor and then put our supplies on the barrier. And we'll put the patient's foot in there. Remember, anytime we get water, who else has to check it? The patient. Don't skip that step. We're going to support it when we lift it. We're going to wash, rinse, and dry the entire foot. We're going to apply lotion, but not between the toes. Between the toes, remember, feet are in socks and shoes. So between the toes is warm, dark, moist. That means that if we put lotion there, it's going to hold in moisture in that area, and athlete's foot or fungal infections are likely to crop up. So no lotion between the toes, lotion everywhere else though. But the whole purpose for you to be there is this. You need to be looking for abnormalities, red areas, wounds, rashes, sores, toenail issues, anything that doesn't look right. We're going to let the nurse know. Now, let's talk about toenails for a second, though. You're not trimming them. You're not cleaning them. Remember that we can't use nail clippers. But if you notice there's a problem, we're going to report it to the nurse. And there's a podiatrist or a foot doctor that's going to come to the facility usually once a month. And they see patients that are already on a list. So they don't go room to room saying, do you need me? Do you need me? They don't do that. They go in and they look at the list. and they see the people that are on that list. That's all they see. So if you do foot care, notice there's a problem, tell the nurse, then the nurse puts the patient on the list, and then the podiatrist will see that patient when they come in. And that's how we deal with foot problems. If you see there's a problem and you don't tell anybody, that problem will never get solved. Okay? Make sure you keep that foot on the barrier. Bare feet should never touch the bare floor. So the foot has to stay on the barrier during this skill. We're going to put the sock and the shoe back on, but make sure there's no wrinkles in the sock. Make sure it's put on correctly. And then we'll put the shoe on and secure it appropriately. So these are all the steps that are required for this particular skill. And we're going to use our principles to check off our list. So we're going to follow the care plan. We're going to do our opening. We're going to wear gloves for this one. We're going to use a barrier, but the barrier is going to go on the floor. We're going to apply linen rules. So that means nothing on the floor. We can put it on the barrier on the floor. That's okay. But nothing on the floor. So when you use the washcloths, don't put them directly on the floor. They need to go on the barrier. Make sense? Don't hold anything up against your uniform, and anything you take and don't use needs to be discarded. We're going to use our washing rules. Whatever we wash, we rinse. Whatever we rinse, we dry. We don't add soap to the basin. We check the water. They check the water. All of those rules. We're going to clean the basin the way we clean all basins. Rinse it, dry it, store it, use a paper towel when handling it. We're going to use these foot care processes that we just talked about, and we're going to do our closing. And if we do all of that, we get all of our check marks, and we pass the test. Remember, they're giving you 8 minutes to do this skill. 13 minutes to do this skill. That's an incredible amount of time to wash one foot. This care plan is only for this one patient. Every patient that you work with will have a different variation of a care plan. Some you may not do foot care at all because they go to the shower room and they get showered, and we do foot care in the shower. But some patients, maybe they need just a little bit more care or better observation. If they have diabetes, we probably want to be looking at their feet every day, not just on shower days. Okay, good. Let's go ahead and watch this video. Hello, good afternoon, Mr. Jones. My name is Patty, and I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I'd like to perform foot care on your right foot per the care plan. Is that okay?
Yes.
Let me close your privacy curtain, wash my hands, and get my supplies, and I'll be right back. After washing my hands, we'll gather our supplies. We're going to start with a barrier on the floor under the patient's feet. So we'll spread the barrier out. And can you move your left foot to the side, please? Thank you. I'm just going to place this barrier on the floor. If you can lift your foot. Thank you very much. And we'll move that shoe out of the way. We'll also need a basin, soap, and lotion. Once the barrier is in place, we're going to get 1 towel and 2 washcloths and take them to the patient's area. You can place a barrier on the floor to kneel on, but this is optional. All right, Mr. Jones, I'm going to go get some water in the basin. I'm going to use a paper towel to turn the water on. Check the water temperature with the inside of my wrist. It should feel warm, not hot or cold, just warm. And we'll fill the basin about 1/4 of the way full. And then throw the paper towel away. Mr. Jones, would you like to check the water temperature?
Oh, that's beautiful.
Very good. I'm going to set this down. For this skill, I need 1 set of gloves. I'm going to go ahead and put my gloves on before we get started. And then I can take your sock off. We're just going to lift your foot and remove your sock. We'll set your sock to the side, being careful not to overextend, and place your foot into the basin. After your foot has soaked for a few moments, I'll place the washcloths in the basin and rinse your foot, and then lift the foot out and place it on the towel, wringing out one of the washcloths and applying soap. We'll apply soap to the top leaf and then wash all surfaces with short, soft strokes or a patting motion. We're going to wash down each one of the toes and then get in between the toes. And then gently we'll lift the foot with support and inspect the bottom of the foot while we wash all areas from top to bottom. And then we'll set this washcloth aside and place the foot back in the basin to rinse. We'll use the second washcloth to rinse the foot, squeezing the water to make sure that the foot has been rinsed well. I'm going to unfold the towel and lift the foot and place it on the towel to dry. We'll blot the foot dry around the ankle, the top of the foot, the heel of the foot, and then we'll lift the foot gently to dry the bottom. We'll take an edge of the towel and slide it gently in between each toe to blot to make sure no moisture remains behind. Now that the foot is dry, we'll get some lotion, warm it up in our hands, and then apply it to all areas of the foot except between the toes. So the top of the foot, the heel of the foot, and the sole of the foot, but not between the toes. And then we'll wipe off the excess lotion. The care plan has told us to replace the patient's sock. So once the lotion has been removed, I'll take the sock, make sure it's right side out, and scrunch it all the way up to the toe seam. We'll put the sock over the foot, making sure the toe seam lines up across the toes, and then we'll secure the sock over the heel, minimizing wrinkles and making sure the sock fits appropriately. And then we can gather our dirty linens and place them in the soiled linen hamper. So we'll place our soiled linens in the soiled linen hamper. Now we can clean our basin. I'll bring the basin to the sink. We will dispose of the water in the sink, rinse the basin, and then dispose of the rinsed water in the sink as well. I'm going to set the basin down, disinfect it per facility policy, and then use a paper towel to pick it up. We'll dry the inside with a paper towel. Throw that paper towel away. Dry the outside with a paper towel and throw that paper towel away. And then get one more for the drawer. After cleaning the basin, we'll use the paper towel to pick up the soap and the lotion and return the basin to storage. We're going to put our supplies away by opening the drawer with a paper towel. We're going to put the basin, soap, and lotion in the drawer, close the drawer with a paper towel, and then we'll throw the paper towels away. And then we'll remove our gloves, being careful not to contaminate our hands. So now I'm going to gather the barrier, and we'll throw this away. And I'll help you put your shoe back on. There you go. Are you comfortable?
Yes.
Is there anything else I can get for you while I'm here?
No, thank you.
Would you like a magazine before I go?
No, thank you.
Your environment is clean. I'm going to go open the curtain and give you your call light.
Thank you.
Okay, Mr. Jones, here's your call light. If you should need anything at all, just press that red button. I'll be happy to come back and help you.
Thank you.
Is there anything else I can get for you before I wash my hands?
No, thank you.
Okay, have a great day. I'm going to go wash my hands. After washing my hands, I'll review the care plan, make any corrections, and tell the evaluator my skill is done. What's that?
I have it down.
You have it down?
Yeah. After washing our basin, we pick up an extra paper towel to open the drawer.
Right.
So before opening the drawer, we are picking up the soap and lotion and putting it to the basin. And which paper towel we're using it? The paper towel we picked up for the
Drawer. Mm-hmm.
Okay,
Yep.
we're using that and we're using it again.
Yep.
Okay.
Yep. All right. Any other questions on that skill? Any other questions on that skill? No? You look like you've got,
No.
okay. All right.
I did have one because
Sure.
you always said the curtain has cooties,
Mhm.
but I always see you open the curtain and then hand them their call light.
The call light has just as many cooties as the curtain because patients in bed will scratch what itches and then use the call light to tell you about it.
Because mine is not the opening, closing the curtain. We wash our hands.
The-
but
Yeah, the patient's cooties are their cooties. So they're going to be all over the patient environment. So yeah, it's okay, perfectly okay to open the curtain and then give them the call light. If you'd rather give them their call light first and then open the curtain, that's fine too. That's not a tested checkpoint. No. That's going to matter a little bit more when you're in a like a cancer setting, or if you're working with immune compromised patients. Then we're going to have different processes that really help isolate the pathogens that we bring to the patient. Yep. Good question. Very good question. All right, so we're going to move on to mouth care. This is brushing teeth. You guys all know how to brush teeth. There's not a whole lot to teach you here, right? We all know the mechanics of brushing teeth. Now, when we're looking at this, down the side are our principles. They're all spelled out for us here. There's a video, test-specific information here. But I want to bring to your attention the test timing information. They're giving you 12 minutes to brush somebody's teeth. Now, if you have ever spoken to a dentist, how long do they tell you should brush your teeth for? 2 minutes, okay? So dentists will tell you that you should be brushing your teeth for 2 minutes. In fact, if you have one of those electronic toothbrushes, the ones that kind of vibrate for you, they will time it for you. They actually run for 2 minutes. So we kind of go into this with the expectation that, okay, we're brushing teeth for 2 minutes, but I'm going to tell you that for the state exam, they aren't timing you. You don't have to do 2 minutes. There's no timing feature for this. They're giving you 12 minutes to get this done. So, and they're not timing the actual mouth care portion, the brushing portion. So don't rush this. Okay, don't rush this. You've got all the time that you need and then some for this. This is a live patient skill. That means that one of you guys might have your teeth brushed for the state exam. I know it's awkward. It's very awkward. Nobody wants to have their teeth brushed by another person if they can brush their own. Your patients don't either. So we have to remember that if our patients can do a skill themselves, they're going to do the skill themselves. We may be asked to set up or clean up or help them with certain aspects, or they might be completely independent and take care of all their own mouth care all by themselves, and we're not involved at all. But this care plan, located at the top of page 93, gives us some different information. I have step-by-step instructions here. I got some review questions, and then, of course, the supplies are located at the bottom of the page. But here's our care plan for this particular skill. It says a resident with natural teeth is lying in bed and needs mouth care. The resident is not able to provide their own mouth care. It doesn't say they're immobile. It doesn't say that they are confused. It doesn't say that they are paralyzed. It just says they can't do their own mouth care. Be careful not to add stuff to that doesn't exist. So let me give you a different kind of patient to think about for this. Let's say that this is a 23-year-old young man in bed who went out last weekend into the woods with his buddies and was dared to catch a porcupine. And he won the dare, but now he's got porcupine quills all in his hands and he cannot perform his own mouth care. Is he going to need mouth care? But he can do everything else himself. He can swish, he can spit, he can sit up, he can do all that. He just can't use his hands. Does that make sense? Okay. So don't put things on this patient that don't actually exist. All right. So we have our principles and then we have our skill-specific steps. We know the principles, so let's learn our skill-specific steps. For this skill, our patient is lying in bed. I know they are because the care plan told me they were. They're lying in bed. Is this a safe position for mouth care? No. So we need to get the patient sitting up. The easiest way to do that is to put the head of the bed up. That's the easiest way. But that doesn't mean the patient can't sit on the side of the bed. Okay. Test the testing checkpoint. Just says they need to be positioned upright. It says we can raise the head of the bed and use pillows as needed, but the patient needs to be upright. Make sense? Upright. So you want to find out from your nurse, if you're going to be doing this and the patient is laying in bed, can they sit on the side of the bed or do I need to put the head of the bed up? That's information that would be helpful to you. And let me explain why. When you are brushing your teeth at your sink in your house, you don't brush your teeth like this. You brush your teeth like this. Why? Right, because you're about to make a big foamy mess. And you know that foamy mess is going to drip. You want to be over the sink. If you are sitting or standing up like this, that big foamy mess is going to end up on your clothes. Make sense? So when we put the head of the bed up, your patient is like this. So where's that big foamy mess going to be? On their clothes. If you sit them on the side of the bed, they can lean forward a little bit more, which makes it a little bit more familiar for mouth care. Does that make sense?
If they can't sit on the side of the bed, can we put a barrier?
I'm gonna talk about that right now. For this skill, the patient is going to stay in bed. They're not going to sit on the side of the bed. We'll put the head of the bed up. And now we've got to think about, okay, we got this big foamy mess going on. So how do I protect their clothes? So in order to protect their clothes, let me go. This is a critical checkpoint. Get the patient sitting up. Hold on one second. I'll get there in a second. This part, this step trips up students. Okay, when do I put the head of the bed up? Because we know that bed controller is not clean. And we can't touch the patient until our hands are clean. So this is kind of like, well, what comes first, the chicken or the egg type thing. For the test, you can put the head of the bed up before you wash your hands. That's fine. That's fine. You can also put the head of the bed up after you wash your hands, and they're okay with that too. I'm not, but the test is. I'm going to tell you how to do this to keep your hands clean. But the problem is that once you get the patient sitting up, right, the head of the bed up, that pillow is behind their head. It's kind of forcing their head forward, but not their body forward. There's a difference there. Okay, make sense? Does that make sense? All right, oops, let me go back here. Let's go. So you can see that here. It kind of forces the head forward. So when you put the head of the bed up, the best thing to do is have the patient lean forward and slide that pillow down behind their back or take the pillow completely away. Either way. But we don't want the pillow forcing their head forward. So if I know I've got to touch the pillow and the patient, I have to do that after I've washed my hands. So we can put the head of the bed up, that's fine, but we can't do anything with the patient yet if we do it before we wash our hands. Does that make sense? You following me? Okay, so the best way to do this, the best way is to do your opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to brush your teeth. Is that okay? Close curtain, wash hands. And then once you've washed your hands, grab a paper towel. Come over and use the paper towel between your finger and the bed controller. So now we're not touching that bed controller. Get the patient sitting up, and then you can slide that pillow down. And it's okay to slide the pillow down because it's the patient's cooties and we're working with them. We're not bringing outside cooties in. Make sense? Okay, once we have that patient sitting up and the pillow is behind their back or removed, then we can put a towel over their chest. And we want to be doing all of this before we put our gloves on because you don't want those gloves to be touching all this stuff and then go into the patient's mouth. If I were going to do mouth care on you, what kind of gloves do you want in your mouth? Clean, absolutely. So does your patient. So we're going to cover their clothing with a towel or a barrier or something here to help catch anything that might drip. This is a tested checkpoint, by the way. Now we're going to wet our toothbrush and put some toothpaste on it. You always want to wet a toothbrush first. It's just like washing your hands. Wet the hands before the soap. Wet the toothbrush before the toothpaste. It just allows that medium to be able to spread more effectively. And then you're going to brush. They don't care how. Just brush all surfaces. Top, bottom, front, back, tongue. They don't care how you do this. They don't care how long it takes to do this. None of that is graded. This is the actual checkpoint for mouth care. This is all they're grading on regarding mouth care. Okay, brush sides and biting surfaces of teeth and gum line with a gentle motion. That's it. Doesn't tell us how long. Just brush the teeth. Then we're going to offer them a cup of water to rinse. And we're going to let them rinse as often as they need to. And we need to have a place for them to spit. So they can spit into a basin like this. They can spit into an empty cup, but they have to have a place to spit. Okay? Then you want to leave their mouth dry. This is a step that is most missed on the state exam on mouth care. Because you're so focused on the actual mouth care, right? You wet the toothbrush, put the toothpaste on, you scrub a dub, give them a rinse, let them spit. And by then you think you're done. And your patient's sitting there dripping. They're a mess. Make sure you're looking at your patient. Remember I said that at the end of every skill, you should review your care plan? Well, you should also take a step back and look at the patient as well. So make sure that they're nice and dry and they look good and they're comfortable. Remember that you're only going to do mouth care on patients that can't do it for themselves. You're not going to brush everybody's teeth. How weird would it be if I came into your house tomorrow at 6 a.m. armed with a toothbrush and said, open wide. Be weird because you've been brushing your own teeth and you're perfectly capable of brushing your own teeth, and your patient's going to feel the same way. Nobody wants somebody in their mouth if they don't need to be there. It's very invasive, very personal. All right, so here's our principles. We already know all of them. So let's take a look at how we're going to get these check marks. This is our checklist. We're going to follow our care plan. We're going to do our opening. We're going to wear gloves because of body fluids. We're going to use a barrier to keep our supplies and our table clean. We're going to follow linen rules. We're going to clean our basin after they've spit in it, just like we clean everything else. We're going to use our mouth care steps to get this done, and then we're going to do our closing. That's the whole skill. They give you 13 minutes to do this. 13 or 8? I can't remember on this one. 12. I'm sorry, 12 minutes to do this. Way more time than you need. This is probably one of the easier skills for you because you already know how to do it. The biggest thing is to remember to sit the patient up. This isn't safe. Cover their clothing so they're not a mess. Make sure you leave their face dry. But the rest of it you already know. You already know how to do this. So this is one of the easier skills for you. Now, sometimes your patients are going to have dentures. That is a different skill. And we're going to learn how to do denture care next week, which is mouth care with an extra step. But that's why we start with mouth care, because we're going to add on to it with denture care. Good? Good? Okay. Remember that this care plan is just for this patient. Other patients would have different care plans. All right, Jake's going to, why did it change it on that one? Oh, okay, hold on. Yep. There we go. All right, that's okay. Jake's going to show you this video, but while the video is playing, he's going to be passing out the test registration packets. Don't do anything with those until we get to that part, okay? All right.
Hello.
Good morning, Mr. Jones. How are you?
I'm well. How are you?
Fantastic. I'd like to perform mouth care on you. Is that okay?
Yes.
I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. I'm going to use a paper towel as a barrier to put the head of the bed up, since my hands are clean and the bed controller is not. Once we get the patient to an upright sitting position, I can throw the barrier away and then adjust the pillow so it's a little more behind his back rather than his head. There we go. Good?
Yes.
Okay, let me go get the rest of my supplies and I'll be right back. I'll gather my supplies. We're going to start with a barrier, and that gives us a clean place to place our clean supplies. So we're going to open the barrier up. And I also need a towel. We're going to get an emesis basin, a toothbrush, toothpaste, and a cup of water. And we also need a pair of gloves. I'm going to get my toothbrush prepared by wetting it and putting toothpaste on, and then storing it in the emesis basin until I'm ready to use it. Mr. Jones, can I place this towel over your chest?
Yes, please.
Thank you. This is just going to help keep your clothing clean. I'll put my gloves on. And now we're ready to brush your teeth. I'm going to brush the top, the bottom, the front, the back, and your tongue. So can you open wide for me? I'll start in the back, on the top, both sides. And then the bottom, both sides. The front, both top and bottom. And can you bring your teeth together? Thank you very much. And then stick your tongue out. Thank you. I'll set this aside, and now we can rinse. Go ahead and take a sip. Another sip.
Yes, please.
Okay. I'll pour the water in the emesis basin, set them on the table, and then I'll take this towel away and put it in dirty linen. I'm going to go clean my basin. We'll clean the emesis basin by dumping the saliva into the sink, rinsing the basin, setting it down, and disinfecting per facility policy. Then we'll take a paper towel to pick it up, a paper towel to dry the inside. We'll throw that paper towel away. Paper towel to dry the outside, throw that paper towel away, and one for the drawer. Now I can return the basin to storage, putting the toothpaste in the basin and using a paper towel to open the drawer to store the basin back in it. We'll close the drawer with a paper towel and then throw those paper towels away. All of these disposables will be disposed of. I'm going to go throw this away. I'll be right back.
Okay.
Now I can remove my gloves. Okay, Mr. Jones, is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Okay. Bed is in the low position. Your environment is clean. Let me get your call light for you. Would you like a magazine before I go?
No, thank you.
Okay. Here's your call light. If you need anything at all, just press that red button. We'll be happy to come in and help. I'm going to go open your curtain and wash my hands. After washing my hands, I'll review the care plan, make any corrections, and then tell the evaluator my skill is done. No, that's actually covered under preferences. So at the end of this, we have to put them up for safety. But at the end of the skill, it's whatever they want. They can lay down if they want to take a nap. They can stay sitting up to watch TV. It's up to them. That's preferences at the end. Okay. Good. All right, one more skill. I'm sorry, I forgot about this one. One more skill. This is a super short skill. One more skill, and then we'll get into the test process. So measure and record respirations. Do you guys remember pulse? What pulse looked like? This skill looks just like pulse. Okay, it looks just like pulse. Very few principles involved. We're going to follow the care plan, do our opening, evaluate if we need gloves, and do the closing. We already know all of those. We do need to learn some skill-specific steps. Down here is your testing information. Somebody with your level of experience should be able to do this within 5 minutes. This is going to be a live person because we need somebody breathing, and they're going to be laying in bed. This is a documentation skill. So that means that anything we document or anything we measure, we have to document. If you forget to document, you will fail because that number in your head doesn't do the nurse any good. You can be off by 2 breaths in either direction. You can be off by 2 breaths in either direction. And normal is between 12 and 20. So what does that mean? If you get 16, right, you're measuring the breaths, patient takes 16 breaths over that minute. If the nurse that's evaluating you got 12, 13, I'm sorry. Yeah, if you got 16, if the nurse got 14, 15, 16, 17, or 18, you're still accurate. Guys, the whole range is only 8 breaths, right? 12 to 20. The whole normal range. They're giving you like half of that as a, normal, as a variance. That's the word, variance. Does that make sense? So for this skill, accuracy does not count as much as technique. It just doesn't count as much because they know that if you're nervous for the test and you get the wrong number for the test, but you still do the skill correctly, that when you get out there and you start working, your accuracy is going to get better with practice, as long as you're doing it properly. But if you're doing it wrong, no amount of practice is going to make you any better because you're always going to practice wrong. Does that make sense? So the technique is going to matter more than accuracy on this skill. Now, that doesn't mean you shouldn't be accurate. You should. But they're not grading you to that degree. Page 55 gives us our care plan at the top, our step-by-step instructions, some practice questions, and your supplies at the bottom. If you get this skill, the evaluator at the beginning of the skill is going to give you a review sheet or a documentation sheet. This documentation sheet is in your book on page 168. This documentation sheet. So you can make copies of this when you're practicing, that's fine. But I've also got the clipboard here for you to be able to use during practice. So here's our care plan. It says patient will be lying in bed for skill, count the patient's respirations for 1 full minute and record your readings. So there's your care plan. Respirations means breathing. We know all the principles, nothing to learn here. Let's learn the skill-specific steps. So we have to count the patient's breathing. That's what we're doing here. Respirations is breathing. But we don't want to tell the patient that we're counting their breathing. Because if I tell somebody I'm counting your breathing, okay, I'm going to count your breathing. Ready, set, go. Yeah, so now people are aware of their breathing and they either breathe faster because they're nervous or they hold their breath. Yeah, yeah, they're like, what do I do? So we don't want to tell this patient that we're counting their breathing. Instead, we're going to say vital signs. I'm going to take your vital signs. I want this to look like I'm taking the pulse. And this is why. Imagine for a second you're the body in the bed. All right, Miss Jones, I'm going to take your vital signs, okay? Ready? Go. How uncomfortable would that be for me to just stand over somebody, stare at their chest, not touch them, not talk to them? This patient is going to just be wigged out by that. Now, that's going to increase anxiety. What do you think anxiety does to breathing? Makes it faster. So am I going to get an accurate reading here? Instead, what I would do is tell the patient, I'm going to take your vital signs, close curtain, wash hands, all of that. And then I'm going to hold the wrist. I'm not on her pulse. I'm holding her hand, right? But this allows her to focus here rather than here. And it'll unconsciously relax the patient. Will get a much, much more accurate reading. Does that make sense? Now, this is actually a graded checkpoint that we not tell the patient that we're counting their respirations, because the test knows that this is going to alter their breathing patterns. In and out is going to be counted as one cycle. So that whole thing is one. If you start counting and you're like halfway through a cycle, like if the patient is exhaling, it still counts. The whole thing counts as one. For the test, our care plan told us to count for 1 full minute. So how long are we going to count for? 1 full minute. But just like pulse, if our care plan does not specify 1 full minute, just like pulse, we can use that 15 seconds and multiply that by 4 to get our 1 minute reading. Normal is between 12 and 20. If we get less than 12, what do? If we get more than 20, tell the nurse. So we're going to count the respirations for 1 full minute. You can have the patient sitting up if you want. It's not necessary. It's actually easier to see respirations if they're laying down. I'll show you that in a minute. But whatever you want, that's fine. But we're going to count for 1 full minute, but so is the evaluator. So just like pulse, we actually have to pick a starting point and say start out loud so the evaluators know when to start counting. At the end of that minute, we will say stop out loud. And then, of course, this is going to require documentation. So we'll do our closing, wash our hands, and document. And we need to be accurate within 2 breaths of the evaluator. Like I said, accuracy does not count as much as technique here. I've got a whole lesson on documentation that you guys can read on page 48. I would suggest that you read this at some point because you may have a written test question on documentation somewhere along the way. There's a trick that you can use when you're taking respirations. People that are laying down, it's easier to see their breathing than it is to see somebody breathing that's sitting up. When you're sitting up, your chest expands, but you actually see it a little bit more in your upper torso, like here when you're breathing. So it's not as easy to see breathing when people are sitting up. But when they're laying down, you can watch the chest rise, but it's actually usually a little more obvious by watching the upper abdomen rise and fall. This area right here, you can see rise and fall. And that's why for the test, they have the patient laying in bed because it makes it easier for you to see the breathing. But there's a really cool trick that you can use. And if you put an alcohol pad on their upper tummy, this area, just lay the alcohol pad there. It will amplify what you see. It doesn't change their breathing at all, but it actually clues your brain in to be able to see it a little bit better. And that's because this is psychology, guys. Your eyes are drawn to movement when it's a contrasting color. This is what kept you safe in the saber-toothed tiger days. Your eyes are just drawn to movement when it's a contrasting color. So if you take an alcohol pad that will be in the top drawer of the bedside cabinet and just lay it on their stomach. Now, the thing about alcohol pads that I love is that patients will rarely ask what you're using it for. They just assume you're going to need it to disinfect something somewhere along the line, and they don't ask. If they do ask, what are you using that for? You can give them a non-answer, and they'll accept it. Oh, I need that for later. And your patient will go, okay. Because alcohol pads are comfortable, familiar. They're used to seeing them. They don't give it a second thought. If you put anything else on their tummy, they're going to start asking questions. Why? If it's heavy, it'll interfere with their breathing. So alcohol pads are perfect. Throw it there, count your respirations, throw it away afterwards. They're designed to be disposable. Make sense? So we're going to put an alcohol pad on their tummy. We're going to pick a starting point. We're going to hold their wrists so that they're focused there instead of the breathing. And we're going to say start out loud. So wait till the second hand gets to the 12 and say start. Now I'm going to count their breathing. In and out counts as 1. Count their breathing until that second hand goes all the way around to the 12 again. And then I'm going to say stop. Now, remember normal is between 12 and 20. Breathing is slow. Look how long it takes me to take a breath. It takes a long time, about 5 seconds. So what does that mean? That means that I can be standing here looking at the tummy going up and down, but I can glance at that clock and back down, and they're still not done with that breath. So this allows me to watch the breathing and also glance at the clock now and then to see where we're at. Make sense? Good? Alcohol pads will help you visualize, but it also helps those evaluators stay on the other side of the room and still see, so they won't be hanging out right over you. So let's see how we're going to use these principles to check off this checklist. So we're going to follow our care plan. We're going to do our opening. We're going to evaluate if we need gloves. We're going to count respirations for 1 full minute. I want you to pay attention to this. There's only one checkpoint that is respiration specific. This skill is so important that you do your opening and your closing, because that's where all of your checkpoints are coming from. Don't skip that. And then we'll do the closing. We're going to follow the care plan exactly. Now, I'm going to show you the video for this. In this video, you can actually see the alcohol pad on his tummy. But I'm also, the words on the bottom, they're going to get bigger when he inhales and smaller as he exhales. So if you watch those words, you can actually count the breaths along with me. Okay? All right, Jake.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. I need to get your vital signs. Is that okay?
Yes.
I'm going to close your curtain. Let me go wash my hands, and I'll be right back. Okay, Mr. Jones, I'm just going to lay this on your stomach for later. I'm going to elevate your forearm, keeping your elbow on the bed. And this will take me about a minute. I'll need you to remain quiet during that time, but I'll let you know as soon as I'm done, okay? And we're going to start. Ready, set, start. Stop. Thank you very much, Mr. Jones. Is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes, ma'am.
Would you like a magazine before I go?
No, thank you.
Okay, bed's in the low position. The environment is clean. Here's your call light. If you need anything at all, just press that red button. We'll be happy to help you. I'm going to go ahead and open the curtain and throw my alcohol pad away and wash my hands. After washing my hands, I'm going to document on the sheet provided by the evaluator and then wash my hands again. After washing my hands a final time, I'm going to review the care plan, think about my skill, make any corrections, and then tell the evaluator my skill is done. Did you guys get 12? Did you get 12? What'd you get? That's okay. Remember that 2 breaths in either direction is your variance. So 13 would still be considered accurate. Yep. Okay. Any questions on what we've gone over so far? Any questions on the skills today? We've covered a lot of ground, guys. You're over half done with your skills. From this point, most of the skills that we're going to learn, just rehash the principles we already know. We do have to learn one new principle, and that's shoe rules that we'll get to next week. And then that finishes up the learning part. Then it's just rinse and repeat, mix and match principles, rinse and repeat. So the hard part is the first 2 weeks of class. From this point on, it actually gets a little bit easier. Okay? So we're going to totally change gears now and go to test registration. So in front of you, Jake should have passed out your test registration packets. I have detailed test registration instructions. I actually did an online registration and videotaped it. And you can find that on my main website, foryourcna.com, under the testing tab. So everything related to testing is under the testing tab. You can see test registration instructions. So if you get home and you can't remember what I told you, go there because the video walks you through every single aspect of this. Below the video, though, is a step-by-step slide presentation, which is more important when you're actually doing the registration because the video will go on without you. So the slides you control. So I have both the video and the slides on that page for you. Okay. So this, it's probably looks like this when we handed it out. Turn it over. And we have the 4 steps of the testing process. This is a 3 to 4 week process. This isn't like you calling up and getting a reservation for a pedicure. It doesn't work like that. This is a totally different kind of test process because it's both a written and a skills-based performance exam. So it's not as easy as some of the other exams that are out there, like real estate, where you just go somewhere and take a written test. Because there's a skills component, the game has changed. Make sense? Okay. So step number 1 here is to obtain a background check. And before anybody says anything about the background check, I went to the Board of Nursing website. Guys, I just redid these slides. You guys are the first class that gets these new slides. I went to the Board of Nursing website last week and I took these screenshots. The Board of Nursing website is extremely clear on this guidance. The background check, frequently asked questions, states that you must have a new background check at the time of test registration. So if you've had a background check for anything else If you work in assisted living and you did a background check, if you are in a nursing program and you did a background check, if you work for a bank and you did a background check, none of those apply. It is very, very clear that you must have a new background check at the time of application. If you don't, it will delay your test process. Okay, make sense? All right. So when you are, let me go back to this screen. When you are registering for the background check, you're going to need an ORI code. Now, if you turn this over, these are your instructions to register for the background check using the company that we suggest. So this page gives you your instructions for the background check. You can go pretty much anywhere. I don't care where you go to get your background check. I don't care. But we have found that DTIS, it used to be Deontis, but DTIS has consistent, fast, no problems background checks. I had a class last year that went to the sheriff's department to do their background checks, and the sheriff's department swore to them that they do the level 2 with a photo, no problems. Every single one of them had delays in their test processing, and some of them it took over 6 months to get their test date. So go wherever you want to go, but I have no affiliation. I don't get paid for them. I get no benefit. I'm just telling you for your own knowledge. These people, they know what they're doing, and there's no delays in processing. But there are others that you can utilize. Now, when you go or when you register, because you have to register online, when you register, you need an ORI number. And I've got that right there for you. It's EDOH 0380Z. It's in bold in the third space. Do you guys see that? You need that ORI number. That's a routing number that tells them what agency to send this background check to. But it walks you step by step through what to do there. When you go do your background check, they're going to take a photo as well as fingerprints, and then you'll also sign electronically. You have to go somewhere for the background check, right? And this is where you would want to go to register for the background check. You'll pay online, and then you'll go. This place is the UPS store at Barclay and Spring Hill Drive. That's where it's going to send you. Okay, UPS store. Not a lot of UPS stores do it, but for some reason, that's the one that shows up in this portal. Okay, good. All right. So once you've done the background check, let me explain to you the whole process, what's happening on the back end. So when you fill out your test registration, that test registration goes to a company called Prometric. Prometric's like the administrator. They're just kind of gathering the information. So you fill out your registration. It goes to Prometric. Prometric then goes to the clearinghouse and pulls your background check. So if Prometric goes to the clearinghouse and there's no background check for you, everything stops right there. It just stops. And Prometric doesn't keep going back in and check for that background check. So it's always best to do the background check first and then the test registration. That way, Prometric goes to the clearinghouse and pulls that background check and puts it together in a packet. That packet goes to the Board of Nursing. Prometric does not clear you for testing. They just gather the information, process your payment, and send it to the Board of Nursing. And the Board of Nursing is going to look at your background check and make sure that you aren't a threat to grandma. That's really what it's all about. if you were young and dumb, and everybody was young and dumb, by the way, everybody made bad decisions when they were young. But if you got caught and you have a criminal record, the Board of Nursing is going to look at that criminal record and figure out, okay, how long ago was that? How serious was it? Did they do what they were supposed to do? Pay their fines, do community service, serve their time, whatever. And have there been any offenses since then? Basically, are they a threat to grandma now? Yes, they were young and dumb, but are they a threat to grandma now? So let me give you an example. Let's say that you got caught shoplifting and you were convicted, you paid your fine, you did your community service, and that was 10 years ago. You've been good since because you were scared straight. You are not much of a threat to grandma. You've learned your lesson. But if you were convicted of shoplifting 10 years ago and 9 years ago and 8 years ago and twice 7 years ago, and the most recent one was 3 months ago, you are a threat to grandma. I can't trust you in grandma's house because you're probably going to steal her silver candlesticks and her medication and her money and everything else. You are a threat to grandma. They're going to look at that differently. Make sense? So the Board of Nursing, it's not a one and out. They look at every situation in total. They look at the offense, how long ago, the severity, have you made restitution, and how often have you reoffended to make their decisions. If they have questions, and again, it's not a you're out, done. I'm not, you're a bad bet. If they have a question, they're going to contact you and they're going to say, hey, I would like some more information on these charges, please. Send me the court records. Now, you're responsible for going and getting those court records and sending them to the Board of Nursing. But they're also going to ask you for a written letter telling them your side of the story. So you're going to want to have that prepared if you have a criminal history. Just kind of type it out, have it ready just in case. Make sense? Now, let's say that you have multiple offenses. They contact you. What's your side of the story? And they're still not feeling great about it. They're not going to block you from testing at that point. They're then going to invite you to come meet the Board of Nursing so they can see you in person and figure out what kind of person you are before they make their decision. So if you have a criminal history, it's not an automatic disqualifier. They're going to look at every situation individually. And they have some really unique things that they can do. We had a class participant many years ago that had multiple DUIs, and the last one was only like 2 years ago. This shows a pattern. And he went through the class. He filled out his test application. He submitted the information they asked for. And then he went and met the Board of Nursing because they're like, nah, I'm not real sure about this. It seems like you might have an issue. Well, he had been in a residential treatment center. He had lived there for 2 years. He was very happy, very set in his sobriety. He was attending meetings. And what they decided to do with him, instead of just saying, okay, you're fine, you can go test, what they said is, okay, you can test. And if you pass, we're going to give you a limited certification, which means that you can work as a CNA in a facility under direct supervision. Do that for a year. And after a year, you can petition to have that restriction lifted, but you'll need written affidavits from your supervisors, that you're in good shape. Well, he did. And he didn't just get written. I mean, he had glowing reports that he was a conscientious worker. He never called out. He was never late. He did what he promised he would do, and they removed that restriction. So the Board of Nursing is not punitive. They don't try to punish you. They try to work with you to help you reach your goals, but they have to do it in a way that makes grandma safe. Does that make sense? Okay. So that is the process. We do the background check first, and then we submit our application. So this is the whole process. So we do the background check. We submit our application with Prometric. Prometric creates the packet, send it to the Board of Nursing. And then the Board of Nursing is going to approve or deny you for testing. They then send that approval or denial back to Prometric. Now, from that point, Prometric has to schedule your test and give you your results. So this is the whole process. It's a coordinated effort between you, the background check provider, Prometric, who coordinates, and the Board of Nursing, who approves. So there's a lot of things involved in this. Does that make sense? There's also a lot of places for this to go wrong. So if you don't get a response back from Prometric within a certain time period, you're going to have to contact them and say, hey, where am I at in the process? Because with all of these agencies and people involved, things can kind of get lost. I'm going to tell you what your time frames are in just a few minutes. Good? All right. So we've done our background check. Now we're going to do our application, which is step 2. This is our website that we're going to go to, prometric.com/exams/nurseaid-FL for Florida. If you are in a different state that uses Prometric, just put, instead of FL at the end, put your state. So Texas would be TX. New York would be NY. Delaware would be DE. So you would put the last two, the last 2 letters are the initials for your state. Now, underneath that are some accordions or drop-down areas. They're all closed up when you look at it. So when you look at this page, you're like, there's nothing here. You actually have to click on where it says application process to open that up. Now, when you open it up, there's a whole bunch of information there, along with 2 links. One is the paper application, which I printed off for you, and the other is the online application. I suggest the online application. It's processed way faster. But you've got the paper application. If you just want to mail it in, that's fine too. All right, so this is what we have in front of us. This is the paper application. The online looks exactly the same, with 3 small variations that we're going to talk about as we go through this. So the first thing that you're going to see on this page is a stop sign. It says stop. Please make sure that your name is your name. If you go to test and you cannot produce 2 forms of ID that have the exact same name that you put on this registration form, you will not be allowed to test, and they do not give refunds. So if you have 2 last names, you need to look on your photo ID and find out, is there a hyphen between them? If there's a hyphen between them, you need a second form of ID that has that hyphen. One ID has to have a photo. So your driver's license, a state ID card, a passport, anything non-expired that has a photo. And the second ID just has to have your signature. So a debit or credit card, social security card, library card will even work. But the names have to match. Very important. We actually had a student about 4 months ago. I say the same thing every class. About 4 months ago that went to test, maybe 5 months ago now, went to test, and they refused to allow her to test because her IDs did not match. They don't give refunds. She called me crying. She's like, how am I supposed to come up with another $155? I don't know. You need to make sure that your IDs match. If you need a second ID, go to the library. Get a library card. Just make sure the name is correct. Okay? Good? They are militant about this. Hey, Jake, can you bring me my phone real quick? I think it's in a cubby. I want to read to you something. I saw this yesterday. This made me so mad, angry. So this is from one of the Facebook groups that I'm in, CNA, and it's CNA State Test Prep Tips is the name of the group. And somebody posted, I'm looking for someone to help me with my knowledge test in Massachusetts. It sounds fine. No problem there. And then I looked at the comments and somebody says, what kind of help do you need? And this was the response. Now understand this is a public forum. Anybody can look at this, right? And I'm reading this straight up. I took a screenshot. I need someone to take it for me because the English language is difficult. I've already tried once and failed. That is test fraud. This was reported. This was reported to their state. This is not allowed. But unfortunately, there's a lot of people that think like this individual. And if you don't have 2 forms of ID that match, you can't prove that you are you. Does that make sense? This kind of stuff happens. Down in South Florida, there were about 500 people that got caught paying somebody to take the test for them. Now, don't you think that grandma deserves to have somebody that's going to care for her that actually knows what they're doing? Remember that CNAs kill just as many people as surgeons every year. We just don't talk about it. So they're strict on this for a reason. Does that make sense? Are we good on that? Make sure you have 2 forms of ID. They will turn you away. They will. Now, below that is going to be special accommodations. So this is ADA accommodations. If you need a seeing eye dog or a sign language interpreter or something like that to be able to take the test, there's a packet that you have to print out. You have to have your physician fill it out and tell them what kind of accommodations that you need. This will delay testing by about 4 months. So if you need ADA accommodations, it will delay testing by about 4 months because they have to put all of this in place and it takes some time. But the option is there for you if you do need it. Now, down below that is going to be your demographic details. So your name, it's going to ask if you've taken the exam since 2002. If you have, check yes, and then just write the approximate year that you took the test, if you can remember it. But that just means that you have a CNA number, so they're going to reuse that number. On the next page, at the top, is going to be more demographics. So your date of birth, your street address, your email address, your race, your gender, and whether or not you have a high school diploma. The high school diploma thing only counts if you're under 18. They still want to gather the data, but it only counts if you're under 18. You can fill that part out at home. We're not going to fill that out together, but I want to go down to the next section where it says criminal and Medicaid, Medicare fraud questions. This is where we get a little complex with this. It's a lot of legalese on these questions. So let me explain to you. If you have a felony in your background, 1 and 2 are going to apply. If you have no felonies in your background, answer no for number 1 and number 2, but leave your A's, B's, C's, and D's blank. Don't answer the sub questions. So if you have no felonies, for number 1, check no. skip everything else, go to 2, check no, go to the next page, skip the A and B, and then go to 3. Now, 3, 4, and 5 are going to deal with Medicare and Medicaid fraud as a provider. This is not as a user. So if you've ever had Medicaid and you didn't requalify or you got caught lying on your qualification, that's not this. This is as a provider. So if you worked for a doctor's office and that doctor committed Medicaid fraud, billed fraudulently and collected a whole bunch of money, and we just had 2 doctors in our county at the end of last year that got caught doing this, by the way. So if you worked for that person, and they found that you were instrumental in that, you knew what was happening and you made it happen, then you are going to be prevented from working in healthcare and being able to bill that just makes sense. But this is a very prescribed process. You would have had to go to court. They would have found you guilty. You would have been put on a list. You would know that this had happened. You would know. So if that applied to you, then answer 3, 4, and 5. If that doesn't apply to you, check no for 3, 4, and 5. Skip all the A's, B's, C's, and D's. Moving down to the next section, which is disciplinary history. This is asking if you've ever been a CNA or medical professional in Florida or any other state. If you haven't been a medical professional anywhere, the answer is going to be no to all 4 of these. They want to make sure that you weren't an occupational therapist in Indiana, knocked around some old people, got your license taken away, and now you want to be a CNA. That's what they're looking for here. Okay. Now we're going to move on to criminal history questions. Do you have one or not? Pretty cut and dried. Just answer yes or no there. The second question is record sealed. So this is also called expunged. So if you had a criminal history and paid a lawyer some money to make it go away, they're still going to find it. The last question in that section has to do with a juvie record. Do you have a juvenile record? If you go to the next page, 4 are some health history questions. I cannot help you with this section. I'm not allowed to help you with that section. So you have to, read and answer those on your own. And then below that is where you're going to put your social security number. And you do have to have a social security number in order to test. Then we're going to go to the next page, 5. Now this I've already filled in for you. So at the top of page 5, you've got certification option eligibility. I've already checked off E3 Challenger, but this is super, super, super important. If you are filling this out online, you have to check E3 Challenger. I know you guys are sitting in a classroom. This is not a 120-hour state-approved class. This is a test prep class. So we are going to all register under Challenger. And something like 89% of all people that test in Florida test under Challenger. So it is the main way that people test in Florida. So you want to check off E3. The section below that, where it says training information, we're not going to fill that out because we only fill that out if we checked off E1 or E2. We checked off E3, so we're going to skip that. I've already put an X through that. The next section is asking, where do you want to test? We are all testing at a regional test site, so I've already checked that off for you. This piece of paper here, this single piece of paper in your packet, these are all of the testing centers in Florida, double-sided. I have divided, this is my version of this, I have divided this up into sections in Florida. So we are in the Central Florida section down here. I have highlighted in gray the ones that are close to us, the ones that are in Tampa. So you can see the second one, or I'm sorry, there's one in Ocala too, for those of you who are in Citrus County. But you can see the two bottom, there's Agilus and Veritas. And if you turn the paper over at the very top, you'll also see one in another one in Tampa as well on Memorial Highway. So you're going to want to figure out which one of those you want to go to. The one closest to us is Agilus. That is the closest testing center to us. If you take the Parkway down, it's near the airport. The others are kind of on the other side of Tampa, like Busch Gardens area. Okay, so Agilus is your closest one. Now, do you see right before Agilus, it says CNA-TAMAIR. That is the code. Every single one of these has a code. So if you look at this page, there's a place for that code to be written in. So you want to figure out where do you want to test, and then you're going to write the code in there. You don't have to test in Tampa. You can test in Miami. You can test in Tallahassee. You can test in Jacksonville. Where do you want to test? But Tampa is our closest. If you want to get on a cruise ship, schedule the test in Miami and jump on a cruise ship afterwards to celebrate. But you can test anywhere in Florida. Good? Good. All right. So this is taken from Prometric's website. Prometric on their website actually publishes these lists of testing centers, regional testing centers. I just consolidated it and made it a little bit easier for us to access and divided it up into regions for you to make it a little bit easier. But this is on Prometric's website. Anybody can access this. So you're going to put the code in the box. Now, below that, it's asking you what kind of test do you want to take. So you guys are first-time testers. That means that you have to take both the written and the skills. But let's say you fail a section. You're only going to have to retake the section that you failed. So if you passed the written and failed the skills, you would only want to retake the skills. That's why all of these options are listed. You will see some that are written only. You will see some that are skills only. And then you're going to see some that are both written and skills. So let's talk about the ones that are written and skills. For most of you, the first box is the one that we're going to check. That first box is clinical skills and written, both in English. But there are some other options as well. If you want the computer to read the written test questions to you, so if English is not your first language, this might be important. Or if you have dyslexia or a reading disability, this might be important to you. You could check the second option there. It says audio. That means the test is going to read the test question to you in earphones. You can also take the written test in Spanish if you wish. And that also comes in audio. So if Spanish is your first language and you'd rather test in Spanish, you have that option. The ones that I have highlighted here, those are retakes. So that's not going to apply to us. So you got to figure out, do you want the plain Jane test, the one that most people take? Do you want the computer to read it to you? Do you want to take it in Spanish? And if you're taking it in Spanish, do you want the computer to read it to you? Okay. First-time testers, it's 155 no matter what you choose. Always 155. If you're retesting, then the fee is going to be based on what you're retesting. To retake the written, it's 35. To retake the skills, it's 120. Those two together create 155. So now if you go to the next page, page 6, we have a box that we have to check here that basically says you have read and agreed to the very last pages in your packet. This is the FBI background check privacy statement and the Florida Department of Law Enforcement privacy statement. So you have these two pieces of paper. You can read them. but you need to check the yes box here that says that you have read and accept these 2 privacy policies. Below that is going to be your affidavit. You have to read each one of those statements before you sign and date. And basically, it just says that everything on this application is true and correct. And I agree to take the test. I agree to play the part of a resident when I'm taking the test for somebody else. And I'm not going to hold them liable for anything that happens to me during the test. Once you've read all of that, you're going to sign and date. Now, the very bottom of that page, there's this. It tells you if you do not receive your emailed ATT letter from Prometric, ATT means authorization to test. So this is your test date. If you do not receive this from Prometric within 10 to 14 business days, those aren't calendar days, those are business days, so 3 weeks, it tells you that you need to contact Prometric. So when you register for the test, when you send this in, if you don't hear back from Prometric with your test date within 3 weeks, you have to contact them. Remember I said there's multiple parties involved here. There's lots of opportunity for things to fall through the cracks. They don't want you waiting 6 months and then call them up and say, where's my test date? You need to do it in this time frame for them to be able to correct the mistakes and get you tested. Make sense? That is your deadline. Now, Prometric is better than they used to be. They're making strides to get better, but there's still some room for improvement here. When you call up Prometric, and the phone number is on their website, right here is their phone number and their email address. When you call up Prometric, the person that answers the phone, their whole job is to get you off the phone. They're going to tell you something like, yeah, it can take up to 90 days to get you approved for testing, or it can take 6 months for you to approve. That's not correct. They're trying to get you off the phone. That's their job. You are going to tell them, my application states, and you want to read it off to them. This is what the application states. Remember, their job is to get you off the phone. You want to get a supervisor because the person that answers the phone can't really look up your specific information. Prometric does more than CNA testing. Prometric is a global test provider for construction, business, IT, security, financial, healthcare, real estate, all kinds of testing. So the person that answers the phone, it's not just for CNA. So you want to tell them, my application states, can I please talk to a supervisor? And then when you get to the supervisor, they'll pull up your specific information and they'll sort out the problem. Good? Good? Okay. The last page here is your payment page. If you're going to mail in your application, you need to fill this out. This is how you're going to pay for the exam. If you're doing this online, there's actually going to be a little payment section for you to fill out, which we're going to talk about in just a minute. So it depends on how you're registering as to whether you need to fill that last page out. Okay. So the online registration form is largely the same with 3 differences. And I want to go over those because they can really mess you up if you aren't expecting it. So one of the differences is, remember this, that we got that test code on? If you're doing the online registration, you don't have these codes. It's just a drop-down menu. But it doesn't tell you where these things are located. It just says Tampa. So you would want to know Agilus is our closest. You're going to have to pick that one out of the drop-down menu. Good? Make sense? All right. The second difference is the payment screen. You're going to have to enter your debit or credit card information in this payment box. But at the very bottom, I don't know why they do this. This is just crazy. I've never seen this anywhere else. you actually have to check a little tiny box, and it's so tiny that people miss it, that says that you authorize them to charge your card. It's not enough to just put the information in. You actually have to authorize the charge. So you have to check that little box, and that little box is missed by a lot of students. And then the third change, or the third difference, is toward the bottom, just above your save and submit buttons, just above, there's a little tiny box. It says, and it doesn't really give you any information. It says supporting documents. And then below that, you have two choices, by mail or by fax. What this means is, remember we talked about that whole background check thing, right? If you have a criminal history, they're going to contact you and say, hey, send us your records and your side of the story. Well, what they're asking here is, how are you going to send that? Are you going to send it by mail, or are you going to fax it over? The problem is they don't explain any of that. It just says supporting documents by mail or by fax, and you have to check one of those boxes. If you don't check one of those boxes, it does not submit. Good? Okay, so three major differences. The first is the testing center is a drop-down menu. The second is your payment screen. You have to check I authorize. And the third is you have to declare how you're going to submit supporting documents, by mail or by fax. Just pick one. I don't care. Now, below that, you've got three buttons. This is important. If you click save, it does not save your payment information. So if you click save and then submit, your application does not submit. It doesn't go in because there's no payment. And it won't give you, it won't tell you that. It won't give you a warning. It won't come up and say your application didn't go through. You'll hit save and then you'll hit submit and you'll think you're good. So don't do that. Just hit submit or hit save, go back up, fill in your financial information and hit submit. Okay, make sense? But if you hit save and then submit, it doesn't submit. All right, so we did our background check. We registered for the test. Now what? Well, you're going to get an email back from Prometric, usually within 3 days. It says, we got your application. When you get that email, there's an attachment on it. And when you get that attachment, it looks like this. This is what it looks like. It's got a whole bunch of boxes on it. The one I want you to pay attention to is the third one down. It says application status. If it says complete, that's good. They got your application, they got your payment, they found your background check, they're sending it all over to the Board of Nursing, yay. And then down here, it's going to say pending approval. What that says is they sent it to the Board of Nursing, we're waiting. If this box says incomplete, something didn't work. They didn't find your background check, or your payment didn't go through, or there's a problem with your application itself. You need to call them. So 3 days after, up to 3 days after you submit your application, you're going to get this. Look at it because it'll tell you if there's a problem. About 7 to 10 days after that email, you'll get another email that gives you your authorization to test. And that, again, is going to be a attachment. Open the attachment. This is what it looks like. It tells you what date you're testing. It'll tell you that your skills test is at 9, your written test is at 9:05. That doesn't mean you only have 5 minutes. It just means you're scheduled for both parts that day. Okay. It'll also give you directions to the testing center. Good. If you don't get this within 3 weeks, what do? Call. All right. So to review, we fill out our application package. We send it to Prometric. Prometric collects everything, sends it to the Board of Nursing. The Board of Nursing approves us, sends it back to Prometric. We get an email that says you've been approved. No test date yet. You've been approved. Prometric will then schedule your test, send you an email with this. Whoop. You haven't just been approved, you now have a date. And they don't give you a lot of notice. They test 7 days a week. So you might be testing on a Sunday. And it's usually only about a week's notice. So you might get an email tomorrow that says you're testing next Thursday. So not a lot of notice. If that date doesn't work for you, you've got to do it quick, like now. So if you get an email, you open it up, it says you're testing next Thursday and you are out of town for something, you can call up Prometric and say, hey, that date doesn't work for me. Don't go into details. Don't tell them what. Just say that doesn't work for me. And then while they're on the phone with you, you will work out a mutually agreeable date. Let's say, okay, the next opening I have would be the following Monday. You can say, yeah, I'll take that one. Okay. If you wait until Wednesday to call and say, I can't make it tomorrow, they're going to charge you because they can't put anybody else in that spot. Okay. All right. Once you get your test date, that test date will come with the date, the location, and directions. Make sure that you are there for testing by 8:30 that morning. It'll tell you you're testing at 9, but you need to be there at 8:30 to get checked in. If you aren't there by 8:30, those evaluators can actually prevent you from testing. All right, so your homework tonight, or over the weekend, you have 2 chapters. You have chapters 5 and 6. 5 is on dementia. You probably want to pay attention to that because you're going to have a lot of patients with dementia in your practice. It goes over some coping mechanisms and how to relate and all of that. Chapter 6 is on skills. We go over skills in class. Just read the paragraphs in between the skills. When you're reading Hartman's book, the yellow book, if Hartman, what they're telling you to do, disagrees with what I'm telling you to do, always go by what I'm telling you to do. We are specific to Prometric testing. Okay? Good. So if there's a discrepancy, go by what I'm telling you, not Hartman. So on chapter 6, read the paragraphs in between the skills and any skills that we're not actively going over in class. So you're going to get another wrap up. You guys getting the wrap up emails? Are you getting those? Okay. If you're not, make sure you let Jake know. And make sure that you have accessed the online course, because remember that the online course will put into practice what you're learning. That's where you can do supply gathering activities, sequencing activities, tons and tons and tons of questions. I think that I've got, between everything that I have created, between the game shows, your book, and the online course, I have something like 1,800 questions that I have created. There's no reason for you not to be ready for the test. You've got access to all of that. If you go to my YouTube channel, it's youtube.com/foryourCNA. Go to my YouTube channel under the live tab. You have to look at the live tab. That's where I've got a whole playlist there for you for the game show.
I remember when we were registering for the class, I remember that we registered with the exam fee today. So are we going to pay the $155 or are you going to pay for that?
No, the exam fee is not, it's not included in this class. So the $370 is for the instruction, the books, the practice time, the classroom supplies, the all the resources that we have, but we don't, it does not include the exam fee. You're paying that to the testing agency, not to us. Yeah, that doesn't come to us. No. Any other questions? Jake passed out your review sheets, so you have those as well. Remember, if you're filling out those review sheets as we give them to you, that makes your study packet. Okay? All right. So those of you that are joining us remotely, thank you so much for tuning in. We will be back on Monday with class 5. So it's all smooth sailing from here. It's just skills based. You will have some practice time. Uh-oh. Unconnected.
It's a loose connection.
Yeah. There we go. All right. The class is going to get easier from this point. You will have practice time built into the end of each class from this point. Today, you've got about 20 minutes, which is 25 minutes, I guess, which is awesome. I was expecting 15, so we did really good on time today. Monday, you'll have some time. Wednesday, you'll have even more time. The following Monday, you'll have even more time. Am I going too fast for anyone? Are you able to absorb the information that I'm giving you? Am I overloading you? Okay. It's not just enough to absorb it. I need you to be able to apply it. And that's where that online course is really going to help you. And you have access to that as well. You'll have access to that for 12 months. All right. So we're going to go ahead and sign off from our virtual people. Thank you so much for joining. We'll see you live for class 5 on Monday morning at 9, and Tuesday is the next game show. So mark your calendars. We'd love to see you there. Until next time, happy caregiving. Bye.